ಈಗ ಆಯ್ತು ನೋಡಿ ಲೈವ್ ಆಯ್ತು ನೋಡಿ.
ಅಲ್ಲಪ್ಪ ನಾನು ಅದು ಫಸ್ಟಿಂದನೇ ಯೂಟ್ಯೂಬ್ ಲಿಂಕ್ ಕೊಡ್ಲಿಕ್ಕೆ ಹೇಳಿದಲ್ಲ ಇನಾಗ್ರೇಷನ್ ಇಂದ ಹಿಡಿದು ಈಗ ನಮ್ಮ ರೆಕಾರ್ಡಿಂಗ್ಸ್ ಇಲ್ಲ.
ನನಗೆ ಗೊತ್ತಿಲ್ಲ ಮೇಡಮ್, ನನಗೆ ಬೆಳಗ್ಗೆ ಅಂದರೆ ಯೂಟ್ಯೂಬ್ದು 20 ನಿಮಿಷ ಪ್ರೋಗ್ರಾಮ್ ಇತ್ತು, ಮತ್ತೆ ಮಧ್ಯಾಹ್ನ ನಂತರ ಹೇಳಿದ್ರು ನನಗೆ. ಹಾಗಾಗಿ ಮೇಡಮ್ ಇದು ಲೈವ್ ಆಯ್ತು ನೋಡಿ ಯೂಟ್ಯೂಬ್ದು. ಇದು ನೆಕ್ಸ್ಟ್ ಇದು ಕೊಡಿ ನಿಮ್ದು
ಯಾವುದು
ಸ್ಟ್ರೀಮಿಂಗ್ ಲಾಗಿನ್ ಮಾಡಿ.
ಸ್ಟ್ರೀಮ್ ಲಾಗಿನ್ ಉಂಟಾ?
ಹಲೋ
ಯಾವ್ದೀಗ
2 ಸರ್ ಸೆಷನ್ 2
ಅವರು ಸರಿಗೆ ಕಳಿಸಿದ ಅದರಲ್ಲಿ ಉಂಟಾ? ಎಲ್ಲ ಒಂದೇ ಮಾಡಿದ?
ಅವು ಅಲ್ಪ
ಒಂದರಲ್ಲೇ ಎಲ್ಲ ಹಾಕಿದ್ದಾರೆ ಸರ್. ಅದು ನಮ್ಮದು ಡಿಪಾರ್ಟ್ಮೆಂಟಲ್ಲಿ ಮಾಡಿದ್ದಾರೆ, ಅದು ಕಾಲೇಜಲ್ಲಿ
ಅದೀಗ ಅದು ಇದಾಗೋದಿಲ್ಲ ಅಲ್ಲ?
ಎಂತ ಆಗೋದಿಲ್ಲ ಸರ್.
ಇದು ಲಾಗಿನ್ ಮಾಡಿ.
ಒಂದು ನಿಮಿಷ ಸರ್, ಅದು ಲಿಂಕ್ ಒಂದಿದ್ದಾರೆ ಸರ್.
ಬೆಳಗ್ಗೆ 20 ನಿಮಿಷ ಪ್ರೋಗ್ರಾಮ್ ಅಂತ ಹೇಳಿದ್ರು. ಮತ್ತೆ ಮಧ್ಯಾಹ್ನ ನಂತರ ಮಧ್ಯಾಹ್ನ ಅಂತ ಹೇಳಿದ್ರೆ ನಾವು ಹಾಗಾಗಿ ನಾವು ಸೈಲೆಂಟ್ ಆದ್ಮೇಲೆ
ಇದು
ಲಾಗಿನ್ ಮಾಡಿ.
ಇದು ಕಾಲೇಜ್ ಇದಾ ನಮ್ಮದ?
ಮತ್ತು ಕಾಲೇಜ್
ಅವು ಒಂಜಿ ಮಾಲ್ಪಿಲೆ ಆತ ಮಾಡ್ತಾರೆ.
ಜಾಯ್ನ್ ಆಂಡ ಬೇಗದ ಜಾಯ್ನ್ ಆಂಡ ಓಕೆ 100 ಆನ್ ಸೀಟು ಬಂಗೋಣ
ಇದು ಹಾಕೊಂಡದ್ದು ನನ್ನ ಆತಿಜಿ ಆಗ್ತಲ್ಲ 91 ಆತಿತ್ತು ನಾನು
91 ಆತಿತ್ತು.
ಹಾಂ ಒಂದು ಮಲಗಲೆ
ಲೈವ್ ಬರೋದು ನಾವು
ಇಲ್ಲ ತಮಿಳ್ ಪನ್ನೀರ್ ಲೈವ್ ಆ ಲಿಂಕ್ ಓಪನ್ ಒಂದು ಮ್ಯೂಟ್ ಬಲ್ದಿರತ್ತಾ ಇದು ಏನಂಡು ಉಂಡತ್ತಾ ಲೈವ್ ಫೋನ್
ಇದು ಅವು ಲಿಂಕ್
ರಂಜನಾ ಮ್ಯಾಮ್ ನಾನು ನಿಮಗೆ ಒಂದು ಲಿಂಕ್ ಕಳಿಸ್ತೇನೆ, ಅದು ಲೈವ್ ಬರ್ತಾ ಉಂಟ ನೋಡಿ. ಓಕೆ ಕ್ಲಾಸ್ ರೂಮಲ್ಲಿ ಆನ್ಲೈನ್ ಮಾಡಲಿ ಅಲ್ಲ ಅವ್ರ ಫೋನಲ್ಲಿ ಅಲ್ಲಿ ಲೈವ್ಗೆ ಏನು ಪ್ರಾಬ್ಲಮ್ ಇಲ್ಲ, ಅವರಿಗೆ ಫೋನ್ ಚಾರ್ಜ್ ಇದ್ರೆ ಆಯ್ತು ಅಷ್ಟೇ.
ಇಷ್ಟೇ ಒಂದು ಲಿಂಕ್ ಕ್ರಿಯೇಟ್ ಮಾಡಿರ್ತೀರ ನಾವು ಓಡಾಡ್ಕೊಂಡು ಖುಷಿ.
ಒಂದೇ ಸರ್ ಜಾಯ್ನ್ ಆಗಲಿಕ್ಕೆ ಹೇಳಿ ಸರ್. ಲೈವ್ ಒಂದು ಅದು ನೋಡಿ ಲೈವ್ ಬರ್ತಾ ಉಂಟ ಅಂತ ತುಂಡ ಗೊತ್ತಾಗ್ತದೆ. ಹಾಂ ಬರುಂಟುಂಡ ಲೈವ್ ಬರುತ್ತೆ. ಹಾಂ ಲೈವ್ ಸರ್ ಈಗ ಲಿಂಕ್ ಜಾಯ್ನ್ ಮಾಡ್ಲಿಕ್ಕೆ ಹೇಳಿ ಸರ್. ಲೈವ್ ಹಾಂ ಅದಕ್ಕೆ ಹೋಗಿ ಜಾಯ್ನ್. ಯೂಟ್ಯೂಬ್ ಅಲ್ಲ ಲಿಂಕ್ ಬೇರೆಪ್ಪ. ನಾನು ನಿಮಗೆ ಒಂದು ಲೈವ್ ಕಳಿಸಿದೆ ನೋಡಿ, ಬರ್ತಾ ಉಂಟು ಅದರಲ್ಲಿ. ನಾನು ಚೆಕ್ ಮಾಡಿದ್ದೆ ಲೈವ್ ಹೋಗ್ತಾ ಉಂಟು. ಲೈವ್ಗೆ ಸಹ ಲಿಂಕ್ ಕಳಿಸಿ ಬಟ್ ಜಾಯ್ನ್ ಆಗೇ ಆಯ್ತು. ನಾನು ಸರ್ಗೆ ಸಹ ಜಾಯ್ನ್ ಆಗಲಿಕ್ಕೆ ಆಯ್ತು. 26 ಅದರ್ಸ್ ಅಷ್ಟೇ ಇದ್ದಾರೆ. ಸರ್ಗೆ ಜಾಯ್ನ್ ಆಗಲಿಕ್ಕೆ
ಸ್ಟ್ರೀಮ್ಡ್ ಇದು ರಿಕಾರ್ಡಿಂಗ್ ರಿಕಾರ್ಡಿಂಗ್ ಆಟೋ ರಿಕಾರ್ಡಿಂಗ್ ಆಪುಂಡು ಕೆಲವು ಇಂದೆಟ್ ಎಂಕನ STME ಚೂಡು ಉಂಡತ ಆಟೋಮೆಟಿಕ್ ರಿಕಾರ್ಡಿಂಗ್ ಆಪುಂಡು.
ಅದು ಫಸ್ಟ್ ಸ್ಟಾರ್ಟಿಂಗ್ ಆನ್ ಇತ್ತಲ್ಲ, ಹಾಗೆ ಆನ್ ಆಗಿದೆ. ಅದು ಸ್ವಲ್ಪ ಡಿಲೇಡ್ ಇರ್ತದೆ. ಇಲ್ಲಿದು ಸಿಗ್ನಲ್
ಅಲ್ಪಲ ರಿಕಾರ್ಡಿಂಗ್ ಆಪ್ಷನ್ ಸಿಕ್ಕೊಂಡು ಇಜ್ಜಂಡ ಒಂಜಿ ಬಟನ್ ಪಂಡ್ಬಿಟ್ಟು ಅವು ಪ್ರೆಸ್ ಮಲ್ಪನ ವೈಟ್ ಈಸ್ ರಿಕಾರ್ಡಿಂಗ್ ಮಲ್ಪನ ಅವು ಗೊತ್ತಿಜ್ಜೆ ತೂಡಿಯ ಗೊತ್ತಿಜ್ಜೆ ಏನು ರೆಕಾರ್ಡಿಂಗ್ ಆಂಡ ಇಜ್ಜೆ ಅವು ಏನಾಗಲಿ ಕೊಡ್ತಾರ ಇಜ್ಜೆ ಹೆಂಗ್ಲು ಗೊತ್ತಿಜ್ಜೆ ತಾ ಕ್ರಿಯೇಟ್ ಮೊದಲು ಮುಗ್ಲೇನ ಮತ್ತೆ ಮೇಲ್ ಐ ಡಿ ಲಾಗಿನ್ ಮಾಡ್ತೀವಿ.
ಅವ್ರು ಬಂದು ಟಿವಿ ಕನೆಕ್ಟ್ ಮಾಡಬೇಕು.
ಟಿವಿ ಕನೆಕ್ಟ್ ಮಾಡಿದ್ದಾರೆ ಆಗ
ಅಲ್ಲ,
ಇವರು
ನಂಗೆ ಸಹ
ಇವರು
ಹೇಳಿದ್ದು ಬೇಡ
ಅಲ್ಲ ಯೂಟ್ಯೂಬ್
ಅಲ್ಲ, ಇವರು-
ಲೈವ್
ಅಲ್ಲ,
ಕನೆಕ್ಟ್.
ಅವರೆಲ್ಲ ಸ್ಟೂಡೆಂಟ್ಸ್ ಹೇಳಿದ್ದ ನಿಮಗೆ ಬೇಡ ಅಂತ.
ಯಾವುದು?
ನಿಮಗೆ ಯೂಟ್ಯೂಬ್ ಲೈವ್ ಬೇಡ ಅಂತ ಯಾರು ಹೇಳಿದ್ದು?
ಅಲ್ಲ ನನಗೆ ನೀವು ಬಂದಾಗ ಹೇಳಿದಲ್ಲ, ನೀವು ಬೆಳಗ್ಗೆ ಯೂಟ್ಯೂಬ್ ನಂಗೆ ಲೈವ್
20
ಬೇಡ.
minutes. ಅಲ್ಲ ನಾನು ಬೇಡ ಹೇಳಿದ್ದಲ್ಲ.
ಅಲ್ಲ,
ನಾನು
20
ಹೇಳಿದ್ದು 20 minutes ಅಷ್ಟೇ ಪ್ರೋಗ್ರಾಮ್.
ಅದೇ ಯೂಟ್ಯೂಬ್ ಲೈವ್ ಬೇಡ ಅಂತ ಹೇಳಿದ್ರಲ್ಲ, ಹಾಗಾಗಿ ನಾವು ಸೈಲೆಂಟ್ ಆದ್ವಿ.
ನಾನು ಬೇಡ ಹೇಳಿದ್ದಲ್ಲ ಸರ್.
ನಿಮಗೆ ಗೊತ್ತಿಲ್ಲ, ಹಾಗೆ ನಾವು ಬೆಳಗ್ಗೆ ಬಂದಲ್ಲ ಮೇಡಮ್ ಮತ್ತೆ ಯೂಟ್ಯೂಬ್ ಕೇಳಲಿಕ್ಕೆ. ಅದಕ್ಕೆ 20 ಮಿನಿಟ್ಸ್ ಪ್ರೋಗ್ರಾಮ್ ಇದು ಬೇಡ ಅಂತ ಹೇಳಿದ್ರಲ್ಲ, ಹಾಗಾಗಿ ಸೈಲೆಂಟ್ ಆಗಿ. ಇದು ಮೈಕ್ ಆನ್ ಇರಬೇಕಾ?
ಲಿಂಕ್ ಅದು ಶೇರ್ ಮಾಡಿಬಿಡಿ ಮಾಡಿ ಎಲ್ಲರಿಗೂ.
ಮೇಡಮ್ ಇದು ಮಾತಾಡ್ಲಿಕ್ಕೆ ಹೋಗ್ಬೇಡಿ ಆಯ್ತಾ?
ನಿಮ್ದು ವಿಡಿಯೋ ಆನ್ ಇತ್ತ?
ಇದು ಮೈಕ್ ಆನ್ ಇರ್ಬೇಕಂತ.
ಜಾಯ್ನ್ ಆದ್ರೆ ಸ್ಟಾರ್ಟ್ ಮಾಡೋದಾ? ಅಲ್ಲಿ ಒಂದು ಚೆಕ್ ಮಾಡಿ. ಮಧ್ಯಾಹ್ನ ಸರ್, ಮಧ್ಯಾಹ್ನ ಸರ್.
ಮೈಕ್ ಆನ್ ಇರ್ತಲ್ಲ, ಸೌಂಡ್ ಬರ್ಬೇಕಲ್ಲ.
ಅಲ್ಲ ಒಂದು ಹೌದು ಆನ್ ಇದೆ.
ಈಗ ಮಾತಾಡ್ಲಿಕ್ಕೆ ಹೋಗ್ಬೇಡಿ.
ಸರ್ ಶೇರ್ ಮಾಡಿ.
ಮೈಕ್ ಆನ್ ಮಾಡ್ತಾರೆ.
ಮೈಕ್ ಒಂದು ನಿಮಿಷ ಎಲ್ಲ ಸೆಟ್ ಆಗಿ ಲೋಡ್ ಡಿಸ್ಕ್ ಸ್ಪೇಸ್ ಹೇಳ್ತಾ ಉಂಟು. ಏನು ಮಾಡುವ? ಈಗ ನನ್ನ ಹತ್ರ ಹಾರ್ಡ್ ಡಿಸ್ಕ್ ಉಂಟು, ಕನೆಕ್ಟ್ ಮಾಡುವ?
ಹಾಗೆ ಆಗುದಿಲ್ಲ.
ಆಗುದಿಲ್ಲ.
ಇದರಲ್ಲಿ ಡಿಸ್ಪ್ಲೇ ಸ್ಟೋರೇಜ್ ಜಾಸ್ತಿ ಬೇಕು.
ಜಾಸ್ತಿ ಬೇಕಾ? ಈಗೆಂತ ಮಾಡುವ ಅದಕ್ಕೆ?
ಇದಕ್ಕೆ ರೆಕಾರ್ಡಿಂಗ್ ಆಗೋದಿಲ್ಲ. ನೀವೇನು ಮಾಡಬೇಕು, ಮತ್ತೊಂದು ಯಾವ ಸ್ಟೂಡೆಂಟ್ ಲ್ಯಾಪ್ಟಾಪ್ ಲಾಗಿನ್ ಮಾಡ್ಕೊಂಡು ಅಲ್ಲಿ ರೆಕಾರ್ಡಿಂಗ್ ಮಾಡಿ ಅಲ್ಲ.
ರೆಕಾರ್ಡಿಂಗ್ ಇನ್ನೊಂದು ಸಿಸ್ಟಮಲ್ಲಿ ಮಾಡಿ. ನೀವು ಅಲ್ಲಿ ಎಲ್ಲ
ಸೆಕೆಂಡ್ ಸೀನಿಯರ್ಸ್ ಇದಾಗಿದೆ ಅಂದರೆ ಜೂನಿಯರ್ ಇದೊಂದು ಕನೆಕ್ಟ್
ಆದ ತಕ್ಷಣ ಸ್ಟಾರ್ಟ್ ಮಾಡಿ. ಅದನ್ನೊಂದು ಹೇಳಿ ಸರ್ ಅವ್ರು, ಶಾರ್ಟ್ಲಿ ವಿಲ್ ಬಿ ಸ್ಟಾರ್ಟಿಂಗ್ ಅಂತ. ಸುಮ್ಮನೆ ಮತ್ತೆ ಲಾಗಿನ್ ಆದವರೆಲ್ಲ ಲಾಗೌಟ್ ಆಗೋದು. ಅಲ್ಲಿ ಒಬ್ರು ಅನೌನ್ಸ್ ಮಾಡಿ, ಶಾರ್ಟ್ಲಿ ವಿಲ್ ಬಿ ಸ್ಟಾರ್ಟಿಂಗ್ ಅಂತ. ಚೆಕ್ ಮಾಡ್ತಿದ್ದೇನೆ. ಇಲ್ಲಿ 45 ಪಾರ್ಟಿಸಿಪೆಂಟ್ಸ್ ತೋರಿಸ್ತಾನೆ. ಸರಿ ಸರ್. ಸರ್ ಬಂದಿದ್ದಾರೆ ಸರ್. ಸರ್ ಜಾಯ್ನ್ ಆಗಿದ್ದಾರೆ.
Hello. Hello.
Sir, yes sir, you are audible sir.
Am I audible?
Yes sir, you are audible.
Right. Okay. So shall all right. The screen share also is the screen also visible now, ma'am. ഇതിന് കാണാം അല്ലേ? ഇത് പെർസെൻറ്റേജ് അത് കൂടി കാണാൻ പറ്റില്ല.
അവർ കാണാം.
നമുക്ക് കാണാൻ പറ്റില്ല അല്ലേ?
ജസ്റ്റ് ഒന്ന് ബാക്ക് അടിച്ചിട്ട്
എന്നിട്ട് ഈ പ്രശ്നം കേൾക്കണം കേൾക്കണം റൈറ്റ്.
സ്ക്രീൻ ഓൺ. മീറ്റിലേക്ക് വന്നെങ്കിൽ
presentation
A very good morning to all. We welcome you all for today's second session. Second session will be presented by Dr. Muralidharan AK, Principal and Professor, MVR Ayurveda Medical College, Kannur, Kerala. Topic for second session is snake bite diagnosis and treatment. Now, I shall take this moment to welcome our today's speaker, Dr. Muralidharan AK, Principal and Professor. For this, I shall request Dr. Shubha ma'am to give welcome address officer. Please, ma'am.
Om Shri Manjunathaya Namaha. Om Dham Dhanvantare Namaha. On this auspicious occasion of World Snake Day, it's my immense pleasure to introduce a revered resource person, Dr. Muralidharan A.K. Sir, and our esteemed keynote speaker. Sir is Principal and Professor, Head of the Department of Rasashastra Bhaishajya Kalpana, MVR Ayurvedic Medical College, Partnikadavu, Kannur, Kerala. Sir has completed his BAMS from Ashwini Ayurveda Medical College, Davangere, Karnataka, and Sir has cleared BAMS with first rank gold medal. Sir has completed post-graduation in RS Rasashastra and Bhaishajya Kalpana from Pandit Taranath Government Ayurvedic Medical College, Ballari, Karnataka. Sir's PG thesis was best amongst PG thesis at national level in 2003. Sir is very popular for his Rasashastra Bhaishajya Kalpana practice. Sir is a revered clinical practitioner in Ayurvedic toxicology too. Sir has worked at Papinshari Visha Chikitsa Kendra as a consultant since a long. Sir is a renowned academician and Sir has guided more than 35 PG dissertations. Sir has presented scientific papers at various national and international platforms. Sir is a recognized PhD guide in the subject of Rasashastra Bhaishajya Kalpana under Kerala University of Health Sciences. Sir is board of members in Board of Studies, Pondicherry University. Sir has worked as Principal, MVR Ayurvedic Medical College, Papinasheri, Kerala, since 8 years. It's my immense pleasure. Sir has been a source of inspiration and support for all the knowledge seekers, and we look forward to excavate the treasure of knowledge through Sir's keynote address. Over to you, sir. Thank you.
Okay, thank you. Thank you very much for your wonderful introduction. So, respected dignitaries and my dear students, it's my happy that to become a part of this wonderful event. And let me thank the organizers for calling me for as a resource person in today's day. As you all know that today is important for World Snake Day we are celebrating. So we're supposed to know more about snakes and as a physician's purview, more about snake bite, and it is how we can manage the thing. And okay, that will be coming up 1 hour. We'll be discussing much about snakes, how to identify the snakes, how you diagnose is supposed to be a case of snake bite, and what are the treatment modalities. In this presentation, I'll be emphasizing more on the modern way of approach. Anyhow, I think we have another session where we are going to learn about Ayurvedic way of understanding as well as the treating the snakes. Okay. So with that brief introduction, let's start today's session without wasting much time. On snake bite diagnosis and treatment. Okay. So as you know that among all animal species, the snake is one of the most widely known. Okay, so there's no doubt on that. We all know that. We all know about the snakes, very familiar creature when it comes to that of any other animal like this. But what we actually know regarding snakes are usually a bundle of unbounded belief inculcated in them from childhood and handed down from generation to generation as received wisdom. Some myths, some superstition, folklore stories, grandma stories, etc., etc., etc. So even though snakes are very familiar to us, we do believe that we know much about snakes, but actually we doesn't know more about snakes. There's a reason, because all these myths, superstition, folklore, and whatever the knowledge we'll get it from social media as well as in visual media, etc., etc., in the form of mythological stories, etc., etc. We have a lot of misconception regarding the snakes are concerned. Okay, so the study of snake is known as herpetology, right? And it's a very big branch. Herpetology is a big branch where you're supposed to know all about the snake, different classification, etc., etc., etc. But as a physician, we are supposed to know minimum about it. That is enough for us. Okay. And the clinical spectrum of snakebite envenomation is known as ophitaxemia. Okay. And out of 2,500 to 3,000 species are there, snakes are there in the worldwide. Among them, 500 are venomous. And based on their morphological characters, how they look like, they are categorized into different families. That's all we know. That's how you taxonomy when you study the things. So you want to know the taxonomy of the snakes, of course, doesn't bother much about the thing. But one thing you have to remember, the red one, they belong to the group vertebrae. That means snakes do have vertebrae with them, and they become the suborder Ophidia or Serpentos. These two things are important for us when you want to know a little bit about the snakes. And as I know that based on their morphological character, they have different families they are divided. And very important things are snakes are cold-blooded, or what we call poikilothermic animals. They cannot maintain their body temperature. They don't sweat at all. So depending upon the environmental temperature, snakes will manage a thing. When it's the environment going to be hot enough, they'll go in search of coldness. And when it's too cold, they'll come in search of warmth. That's how the snakes could able to adjust their body temperature based upon the environmental changes. That's why the snakes bites are closely related to rainfall as well as temperature. We'll come to that later. Then the major families in the Indian subcontinents, what we get here are, they can be classified into Elapidae, Viperidae, and Hydrophidae. Elapidae are, as you all know that, they are common cobra, king cobra, and kite belongs to the family Elapidae. And in Viperidae, we do have Russell's viper, pit viper, and saw-scaled viper. And Hydrophidae are the sea snakes. And in Indian subcontinent, we can have 62 venomous snakes are there. When it's come to epidemiology of snake bite, that means incidence of snake bite. Snake bite remains a public health problem in many countries, especially in developing countries. Okay. Then true incidence of snake bite envenomation could exceed 5 million per year. Sometimes it looks to be exaggerated, sometimes it looks to be overrated. Why? Because we don't have a clear-cut data regarding or statistics regarding the snake bite, but on average we say that incidents may exceed 5 million per year. In that 5 million, 1 lakh of these will develop a severe consequences or sequelae, what we call complications. Okay. When it's come to in India, highest incidence of India, Maharashtra, West Bengal, Tamil Nadu, and Kerala might not be in a chronological order, but these are the areas where much more paddy field than wheat as well as sugar cane have been cultivated, and the fauna and flora of these particular states are having a facilitating environment for the snakes to grow. That might be the reason. So it's not, of course, not supposed to be in a what we can call chronological order, but still we have much more number of snakes in these particular areas. And mortality of snake bite may vary from 2 to 10%. It's very high compared to any other disease. If a mortality ranges from 2 to 5, it looks to be very high. That should say that's a public health issue. And nowadays, snake bite have been categorized into notifiable diseases. Okay, that's the reason. So it's in a developing country. It's a big health concern in terms of snake bite is concerned. And what are the reasons for snake bite, or how snake bite really happening? How we can categorize them? We can have two classification. One is called hazardous, and the second one can be called as illegitimate. The hazardous one is nothing but when snake bite occurs when a human encounters snakes accidentally. Okay. 90% of the snake bite are because of hazardous. Accidentally, when a man encounters the snakes, they are going to bite as a defensive purpose. And one is called illegitimate. Illegitimate is nothing but during snake handling. Okay, people who work in the snake park, they will handle the snakes, and sometimes due to the influence of intoxication, most of the time because of the alcoholic intoxication, to show the bravery, the people in a group may catch all the snake, they'll put it on their head, neck, etc., etc. That might also lead to snake bite. We do have the cases reported in this particular way. Okay. So these are the reasons for snake bite. But in Ayurvedic classic, a lot of things have been explained. What are the reasons for snake bites, and which I doesn't want to touch on. And one more very important thing we're supposed to remember that 80 to 90% of the snake bite are non-venomous. That means that drug does not require any treatment at all. Okay, if you console the patient, do the first aid properly, then any practitioner in a village side also can be managed the snake bite, provided the diagnosis has to be perfect. So it doesn't have to panic. What we see that in movies or in serials, etc., if a patient is bitten by the snakes, he loses the consciousness, otherwise sometimes you're going to vomit the blood, then immediately going to die. Absolutely, it's not going to be happening. Okay, so we'll get a time to intervene this particular time, and 90% of the snake bite non-venomous, which does not require any treatment at all, but we could able to diagnose the thing properly and manage the case. Then any rural practitioner also can manage the snake bite cases. Now let's come to the age and sex incidence of snake bite. Okay, all age group are prone to get the snake bite, but the large majority, so 90%, we can say that the male aged 11 to 50 years. Okay, usually in a offline class, we'll ask what is the reason and all, and we will be interacting. Anyhow, in online, we have the limitation to interaction, so let me answer why this 90% male aged 15 to 50, 11 to 15 are prone to get snake bite. Why? Because these are the age group, they go outside in the evening hours. Okay, and high incidence is midnight to 5 a.m. and as I told in the early, since they are poikilothermic or cold-blooded animal, there's a seasonal pattern is there for snake bite. Okay, this is closely related to rainfall and temperature. In temperature, when it rises in the month of in Kerala especially, of course in Europe also you can consider in the month of April, May, we'll get more number of snake bite. Why? Because the temperature will be too high in the atmosphere. Okay, and the hole where the snakes are what you call buried, or we can stay, it's going to be hot in the evening hours. Why? Because by the conduction, the environment will be hot in the morning, but gradually the temperature comes down in the evening hours. By the time, by means of conduction, this temperature will be transferred to the earth. So the evening hours, the holes or what you call burrow where the snakes will be living or staying, whatever you can call, going to become hot enough. So in search of a coldness, they will come out to the ground. So that time in evening, if a patient walks without any proper precaution, etc., there's a chances of getting snake bite. And then the question arises, then why in rainfall? In rainfall, what happens due to the gushing of the water? It may enter into the burrow. So again, the snakes cannot stay there; they'll come out. Okay, these are the reason snake bites are closely related to rainfall as well as temperature. Okay, then let's learn a little bit about the snakes. Okay, so the skeleton of the snakes is what we call the morphology. The external features of the snakes are skeleton is not very complex. Why? Because they do not have any appendages. They doesn't have the limbs, upper or lower limb. It's a slender-like thing. So it's not very complex. And all snakes have vertebrae, ribs, and a skull. That's what I told. They are vertebrates. And snakes can have between 130 to 500 vertebrae with the ribs attached to each one of the things. There will be a pair of ribs attached to each vertebrae. That's the thing. Snake might have 500. You can imagine human having only 32, isn't it? 33 pairs, etc. We say, but whereas 130 to 500. That's the reason some snake even stand erect at a height of 6 feet, especially king cobra and all. They will stand at a height of 6 feet because they got a very strong vertebrae. And they don't have movable eyelid. Very important. Snakes doesn't have the movable eyelids. That's the time when you look into the snake, you can see that the snake might be staring at you because they don't have a movable eyelids. As I told, they don't have the appendages or limbs. They don't have external ear opening. Okay, and that's the thing. They don't listen. The snakes don't listen the sound vibrated through the air. They cannot listen. Then they don't have the sternum. They don't have the urinary bladder. Okay. And most species have only one functioning lungs, and second one usually will be vestigial. It's not functioning. This is how the skeletal system of a snake look like. You can see that there are fangs. When you start from the head, there will be eye, then fangs will be there, skull, large jawbone will be there, both upper and lower. Then they'll got the vertebrae. There's a lungs you can see there, then ribs attached to each vertebrae, and of course liver, esophagus, stomach, and intestine, testes. Then kindly rectum followed by cloaca. Cloaca is the common aperture for excretion as well as copulation. Of course, snakes have very less, they got much more metabolic activities, so very less excreta they usually throws out. Then they got a small tail, they got a kidney also. This is how usually the skeleton of a snake looks like. Then they got skin, the outer covering. Most of the things are very important for a physician's purview or when you want to learn the hepatology because they give an identification marks for this. So skin consists of a scaly integument that protect the animal from abrasion and prevent water loss. And we got classifications are there actually. The scales on the back as well as slide and numerous number of things are there. For time being, it's not important for us. As beginners, it's not important for us. And the body scales are there. They're less and smooth or skeletal with a noticeable ridges will be there in the scales. And as you told, the coloration and marking. So this coloration and marking help us to distinguish one snake from another. And this marking may be stripes we do have, saddles, spots, diamonds, bars, bands, etc., etc. So different coloring, different marking on the skin of the snakes help us to distinguish one snake from the another one. This classification or this way of explanation is very well explained in our Ayurvedic classics, where how we can differentiate the snakes like. I think you will go already exposed to that. Otherwise not, go to that and try to identify the snakes based on Ayurvedic classification. Then another very common phenomenon you can see with the snakes is what we call skin shedding, or is called as echidiasis. Okay, so snakes shed their skin when they outgrow. Okay, because it told they doesn't have the limbs, so as a tear and wear mechanism also it's going to be tearing will be there. So they does it as a periodic intervals. 10 to 15 times in a year in a juvenile snake is going to shed their skin, 2 to 4 times in an adult, and Of course, usually we say that we have a myth, or we have in our traditional way, we say that whenever we see a shredded skin, you have to be careful about, because snakes will be the nearby vicinity. The chances of getting a bite will be more enough. These are all reality only. These are the truth we're supposed to understand. And soon after shedding the skin, if a snake's bite, usually we say that in our traditional way of belief, death is inevitable. Absolutely, it's correct way, because during the process of the shedding of the skin, as I told, there doesn't have external eyelid, so the covering over the eyes also become what you call opaque. So see, snakes cannot see for 1 or 2 weeks. They cannot have a clear vision, so they will be deprived of the prey. They don't get food in that particular time properly. Once they shed the skin completely, they will have very good visibility, and since they have too much hungry, they have too much of venom. So when they bite the very first prey, they inject much more quantity of venom to the prey. So that the soon after the shedding of the thing, if a person get a snake bite, the quantity of venom injected to the body will be comparatively very high. All right. That's the reason the classics say that you have to stay away from such a, if you see the shredded skin. They got 2 layers, one outer layer and inner layer. As we term them, that outer layer is called as epidermis. That outer epidermis, they're going to renew periodically. Teeth and fangs are very good important for us first to diagnose the snake bite. So in a non-venomous snakes, they got in the upper jaw as well as the 2 jaws, they have 2 rows of numerous small teeth curved backwards. You can see in the front, the first 2 things. They show that the non-venomous snakes with their teeth, they don't have the fangs. Very clear. Okay, make it very clear. Non-venomous snakes don't have the fangs. They got only teeth. So 2 rows of numerous small teeth will be there, that is curved backward. And in the lower jaw, 1 row of numerous small teeth curved towards back to the mouth. And another variety of the very rare is called as Himalayan keelback. In our vicinity, we don't have these snakes. They do consider as a non-venomous snakes. In the upper jaw, 1 row of moderate sized teeth on each side, and a pair of, we call it as rear fangs. Fang deep into that of the throat they do have. If you put your hand deep into the throat, then if you bite with that particular fang, then envenomation might take place. Otherwise, these snakes are considered to be non-venomous. They catch all the prey. During the process of swallowing, they inject the venom. That's what it's. Of course, we don't bother much about, because this variety is only Himalayan keelback has that thing. We don't have that snakes in our vicinity. Whereas the venomous snakes, they got in the upper jaw, small teeth are there as well as 2 fangs are there. In the lower jaw, they don't have the fangs, only small teeth are there. But most of the time, when you see in the comics, when you see in a serial, etc., when snakes are drawn, there will be 2 fangs on the upper jaw as well as 2 fangs in the lower jaw. Usually people will draw. Actually, it is a wrong concept. Usually snakes don't have the fangs in the lower jaw, only they have in the upper jaw. So this is how the things look like. Okay, in the left hand side, this is the venomous snakes with the 2 jaws, and in the lower they have very small teeth. The right hand side, we have non-venomous snakes, which is small teeth curved backward. They don't have the fangs at all. The third one, Himalayan keelback, don't bother much about. They got only what called rear fangs. And the venom, of course, a very big topic at all. We doesn't want to know much. I doesn't want to go in detail about the venom. But very basic things are, venom itself is a poison secreted by the animal for their defensive or offensive purpose, and they are originated from the digestive enzymes. And there will be a gland will be there that's called venomous gland. This is a modification of the parotid salivary gland, and they are composed of as many as 100 different peptides, enzymes, and toxics, etc., etc., etc. So that's about very brief about the venom. Okay. So the purpose of the study, especially for the medical importance, snakes can be categorized into 2. One is called venomous snakes and non-venomous snakes. And I think already you might would have been studied. Venomous we will categorize in India. We call this big 4, because these 4 snakes are commonly have serious health hazard to the human being when they're encounters. They are cobra, kite, rhesus viper, and saw-scaled viper. Apart from that, of course, we do have pit viper. Okay, hump-nosed pit viper we call. Different species are there. Hypnale species is very common in our vicinity and all. So even though pit viper in all editions textbooks say that they are venomous snakes, but medically not important. In olden days, with the pit viper bite, the death rate was comparatively less. But nowadays, pit viper also causes death. And sneeze snakes, of course, there are two varieties are there in that. You'll get non-venomous and venomous. But venomous snakes bite in sea snakes are comparatively less because very, what you call, a few population is prone to get things. People who go deep into the sea for fishing, they are going to prone to have a threat of these particular snakes, but comparatively they are less enough. Then there are another category what we call non-venomous. So these are the very commonly seen big four. The left-hand side cobra, then right-hand side what is called crate, left-hand side down we call Russell's viper, and right-hand side we can see soft-scaled viper. These are the very four commonly human being encountered, and what are the complications they're going to make. That's what they classified in the big four. Now let's have a look about the non-venomous snakes. There are a lot of non-venomous snakes are there. Here, of course, we do study Padartha Vijnana, etc., etc. So as I told that there are more than 550 species are there in India. Being an Ayurvedic physician or being a physician, very difficult to find all the snakes. So what we do here, we'll go back to our classics where they say that Pramana has been explained. To want to find out the known thing from unknown, what we do that we separate the known thing from unknown, isn't it? Arthapati, etc. we call in some extent. We can go back and search the classics. So here what we do that only 4 snakes you be confident enough, so that the rest of all the things were put it under non-venomous thing. So very commonly things are rat snakes, checkered keelback, and green whip snakes. Of only 3 hours total. This is the checkered keelback. Okay, green white snakes. This is called rat snakes. Okay, in our vicinity we'll get this particular one with yellow with a black coloration. It's a very big snakes and a beautiful snake also. This is what we call hump-nosed pit viper. Okay, this is very commonly seen in our localities. Of course, these are venomous. Modern classification, medically not important, but nowadays they do cause death also. We'll come to that later. So based on the systemic effect of snake bite, as a beginners, I suppose this is better to learn this way only, because of course this classification is outdated. But still, how as a beginner to learn the thing in a proper order, I think this is going to be good enough. Where we got neurotoxic snakes, cobra and crate. Chemotoxic snakes are there, viper, so scaled viper, and myotoxic. Most of the sea snakes are myotoxic. Why nowadays it's become outdated way? Because in hemotoxic snakes, we will get neurotoxic symptoms also some extent. I have seen the thing. And in neurotoxic also we'll get hemotoxic symptoms. So that's how they say that this classification is outdated. But as a beginner, we can learn in this way so that the understanding will be better. And the clinical manifestation of snake bite is wide spectrum. We cannot say that these are the limited things we can see in the snake bite. Absolutely not. They are wide spectrum. They are minimal to no symptoms at all. Sometimes they won't get any symptom at all. Sometimes minimal symptoms is there. And in some cases, you'll get systemic manifestation immediately leading to death of the patient. So in that way, the clinical manifestation of snake bite is wide spectrum. And sometimes even a venomous snake bite will come without any symptomatic or systematic effect at all. Okay, so snake bite with no manifestation, there are 2 possibilities. One, it is a non-venomous bite. Snake doesn't have the venom, say they don't going to inject, so you don't get any manifestation at all. Sometimes venomous snakes bite, but there won't be any symptom at all. We call it as dry bite. Why? Because the snakes might not injected the venom to the prey's body. There are the reason for that, because they are very stingy in spending the or in releasing the venom. So seldom they inject very less quantity, right? Then without injecting a venom also they will bite. That's called dry bite. And sometimes the venom may be sprayed into the victim's body before it is entering into the skin. This is a possibility. And sometimes we'll say superficial bite. The bite might would have happened on the clothing or on the chappals, etc. So venom might not be entered into the body. So this is the reason a snake bite without any manifestation, 2 possibilities, non-venomous and a dry bite. And signs and symptoms. This is very important to diagnose the snake bite. Okay, there are non-specific early and signs of systemic manifestation. There will be a non-specific early symptom. There won't be any symptom at all in the early. Gradually it will develop, and finally you will get the systemic manifestation at all. So to classify, to understand in a better way, we can classify them to 2, what is called local manifestation and specific manifestation. Let's look into the very first symptom will be manifested will be the local manifestation. Then specific manifestation are sometime by fright. Okay, patient may collapse. Neurotoxics, okay, hemotoxic, cardiotoxic, myotoxic, or rare complications also will be seen in case of a specific manifestation. Even I have seen a person, he was working with the bridge construction, and he will be hanging and painting the bridge and all. So he'll be brave enough, isn't it? But he has got a snake bite. He came to our hospital. By the time he reached there, he was almost collapsed. Okay. But by looking at the bite side, it was non-venomous classical rat bite. So he was, of course, a person from Karnataka somewhere. He was working in the bridge painting and all thing. So I told him that nothing to worry. It is a non-venomous one. So gradually he regained the conscious and all the what you call respirator and all thing become normal within 10 minutes. So by fright also sometimes people will die because of the snake bite. Okay. And the local manifestation, these are the early signs in a snake bite. Within no time, okay, immediately after bite, you will get the local manifestation. And sometime up to 30 minutes, there won't be any local manifestation, but gradually that develop. Okay, and especially in neurotoxic snakes, it take a long time because the local manifestation will be comparatively less in neurotoxic snakes. Okay, so commonly seen local manifestations are, you can see in the photograph. Local pain with the radiation. Patient will be complaining of local pain, tenderness, and small reddish wheal. You can see in that particular picture. There will be local edema. Then sometimes, especially in P2 hyper, will get a bulle, appearance of the bulle will be there. And regional lymphadenopathy, nearby very regional lymphadenopathy will be there, and gradually will go to the features of necrosis. Of course, it takes time, 3 hours to 4 hours will take for the necrosis immediately, but you'll get these particular symptoms in a local manifestation. And systemic manifestation, as you told, by fright itself, the patient will have the systemic manifestation like transient pallor will be there, sweating and vomiting, and psychological shock will be there. Then neurotoxical manifestation will appear within 5 minutes. Sometimes it won't be any manifestation at all. It will take 10 hours or even late. Even I have seen after 12 hours, I have seen the patient neurotoxic snakes with cobra bite with the systemic manifestation after 10 hours. Up to 10 hours, patient will be very comfortable. That's why in national protocol, we say that 24 hours of observation is mandatory for any suspected case snake bite. Why? Because the manifestation may last even after 10 hours, starts even after 10 hours. That's the reason I want to recall you that what was seen in the TV serials or in the mythological stories, immediately after bite, there won't be blood vomiting, patient won't be going to die. Okay. Then there will be bilateral ptosis, uncontrolled drooping of the eyelid, we call it as ptosis. There will be bilateral ptosis, diplopia, double vision, patient will be complaining. Then difficulty in opening the mouth and speaking. Then muscle paralysis, coma. If treated gradually, will go to and patient go to death. This was the systemic manifestation commonly seen in snake bite. So this was in brief about what are snakes, how they are classified, what are the things we are supposed to look into when you see a suspected snake bite. Now let's do the very what I call serious business, like how we are going to diagnose the case. Okay, so very simple. The red one you can read. There is no simple, reliable, cheap, and ready hand method for diagnosis of snake bite. This is supposed to remember. Okay, there is no very simple thing. There is no 100% reliable. There is no cheap, and there is no ready hand method for diagnosis of the suspected snake bite. And how we'll proceed? So we can go into the 4 different headings. First thing, identification of the snakes. Second, by inspecting the fang marks. Third one, by laboratory investigation. Of course, they got imitations. Then fourth, by looking for local and systemic symptom. By combining all these 4, we can diagnose the case. Of course, experience also matters in this particular condition. But based on all these 4 only, we are going to diagnose the snake bite. Let's see one by one. Identification of the snakes. As I told, it's not possible to 550 species. Identification is not possible for a physician's purview. So what we are supposed to do that, as I told that only the 4 snakes, which are very commonly bite in India, is supposed to able to identify these particular snakes. Why? Because if a patient brings if a suspected snake bite, they will search in nearby the snake, what you see, they kill and they get it to the hospital. So usually the patient brings most of the time, even though we don't encourage them to kill the snake and get into the hospital, but sometimes they'll get the snakes to the hospital. Otherwise, sometimes they'll take a photograph nowadays and they'll show to us this is the snake is bitten. Most of the time, of course, our diagnosis go or identification go correct, but 100% you cannot reliable that thing if a patient get the snakes to the hospital. Why? Because if a patient is bitten by the snakes, very first thing they see that they search in nearby vicinity. The very first snake, what they see, they kill the snake, they will get it to the hospital. Sometimes that might not the snake which would have been bitten the person, isn't it? It's happened. I have seen 3 or 4 cases like that. They bought a venomous snakes, so we were very vigilant, but by looking at the bite mark, it's a non-venomous, isn't it? So that might happen. Only 1 or 2% error might happen in that. The snake which have been bitten, the person might not, they get it to the hospital. Okay. Right. So this is how we are going to identify the snakes. So this is nothing but think all if you can identify the same. This is nothing but cobra, what you call naja naja. They got a hood, but a patient if he kills the snake and get to the hospital, they don't have the hood at all. Okay, the neck will be paralyzed. There will be a single or double spectacled sharpened mark will be there. A white band and a dark color body. This is how usually they look like. There are, of course, they grow a very big snake there. Okay, adult snake will go 3 feet to 7 feet, and they have a very good swimmer. Because in a water, but sorry, if a patient comes to us, usually we'll ask her what time is bitten, where he got the bite. All this matters to diagnose the case. Okay, so here, since this is a chances of getting the snake bite in the what you call pond or in a river, there's a possibility of a cobra because they are good swimmers. And they are often seen in or near agricultural field of human habitation. Their favorite food is rat. Whenever there is a possibility of a rats are in the vicinity, rat snake will be there. Also, there is a chances of seeing cobra in that particular thing. They'll be active day and night, and commonly in evening and early morning. If suppose a patient get an early morning in a pond, if you got a bite, or in early morning, if a people collect to what you call the coconut ratches, etc., they just dump somewhere. There'll be a chance. There'll be waste also. Will be food waste also. If you're going to dump there, there is a possibility of seeing the cobra as well as rat snake. Okay. If an early morning somebody go and collect these coconut ratches, they'll put their hand, they'll get a bite. So there are possibility that it might be a rat snake. Otherwise, there will be a possibility of a cobra. That's why the time and place, etc., also plays an important role in the diagnosing aspect. So by looking at this, okay, we can diagnose this is going to be a cobra. Common crite. Okay, Bangaris celarius, that's what you get in our locality. Okay, there are branded crites are known. Northeast will get banded crite also. It's a very beautiful snake, very shining snakes it is, but most what I call dangerous snake it is. It's an occurs in field, scrub jungle, and is often found in the vicinity of human habitation. They have a what you know known to take up residence inside the house. Usually in the winter season and all, they enter inside the house. They may get into the bed because they are in search of partner. They'll sleep with the person. Sometimes if you get hurt, it is going to bite. Since it has a neurotoxic, the local symptoms will be comparatively less. So the patient don't have any local symptom at all. He don't have a pain. He don't have a burning sensation. So he sleeps again. He turns and go to sleep. During the sleep, there will be neurotoxic effect will be there. There will be respiratory failure will be there, and the patient go to anoxia and finally the death occurs. This is what usually see that morning if you get up a person found to be dead because of the snake bite. Most of the cases it is going to be that of a common crite. So very beautiful snakes, and it's not a big snakes. It's got only 3 to 5 feet in length. Sky blue or bluish gray or brownish black, the color they have with a shining thing, and it's a nocturnal. That's the thing. During the day they rarely bite. During the night they enter the hut and other human habitations where persons sleeping on the floor are likely to get bitten, especially in the cold season. That's what you're supposed to see. That's what, especially in the villages and all, usually advise that not to sleep in the ground with a hut if you're a hut like setup. This is called Russell's viper, Dabaya russelli, very common snakes. 80% of the venomous bite in our locality are because of this Russell's viper. Very beautiful snakes. Okay. Mandali, what you call in Sanskrit, very common snakes. It's not a very big snakes. Its average is 3 feet length. Large brown or black oval marks on brown or yellowish brown body they do have. Head is flat and triangular and very short and thin skin. You can make it a very short thin skin they do have, and usually moves in height. Night hours. They found in open, grassy areas and scrub jungles and rocky hillocks. Okay, especially in Udupi area also almost have similar fauna. So there is a possibility of seeing these snakes very common in that particular region. These are called so-scaled viper, Echinus carinatus. Of course, it's not that common, but very poisonous snakes. Usually, they found in 1 to 1.5 feet length. It doesn't know big snake it has. Venom is more toxic. Head is triangular and mostly moves at night. They make a rasping sound. That's called so scaled. Okay. When they injected, when they agitated with both the so, they're going to rub each other. So it's giving right a so scaling like so when you cut a wood with a saw, what sound will get? Rasping sound. Same sound is going to develop. That's what it's thing. And it's very commonly found in the dry hillocks, especially dry stony hillocks. They're going to be found very commonly and sandy regions. So these are the first one. How we are going to diagnose the snakes? If a patient brings a snake or photograph, or we show the patient at least to recall the snakes by showing the photographs, so we can sum that. Okay, what snake might would have been bitten. Of course, I told 100% we cannot rely upon the thing, but of course that gives a very first line. It gives an idea which snake might would have been bitten. Then by infecting the fang mark, the second way you go to the by infecting the fang marks. So as I told that snakes got in the upper jaw only 2 fangs, so there will be a presence of 2 puncture wound. I think all your second year students you know what will be a puncture wound will be. Okay. There may be a few millimeter to 4 centimeter, but don't expect always the 4 centimeter because 4 centimeter it will look to be a very big snake. It has to be, and usually there are types of jaws also there. Of course, you go in deep, a little more if you study, you can find out there are different types of fangs also supposed to be the classification, right? So especially in Russell's, people will get these 4 centimeter because when a big snake bite, then only the 4 centimeter distance will get the 2 bite marks. And 1 to 8 mm in depth, clinically we cannot assess it. Of course, only it's out of what you can call academic interest. Then in non-venomous snake, because you told they don't have the fangs, they've got very small teeth curved backwards. So there'll be a scratches will be there. I'm going to show you different photographs so you'll get an idea about the things like. So look at it. Hatchy-patchy things with the blood oozing. This is nothing but a non-venomous snake, but you cannot see only hatchy-patchy abrasions you can see there. So if a patient comes with the extremity, bitten in the extremity with the bleeding and hatchy-patchy things, we can very clearly, it is a rat bite, classical rat bite. Look at this, very clear. There is no what you call puncture wound-like thing you can elicit here. Here also, see some very simple abrasion you can see there. This is also non-venomous. Look at this. This is also venomous because when you just go to collect the coconut rashes or whatever the thing, the snakes think that it is a food item, then it's going to bite the thing. The finger will be inside the mouth of the patient snake. So the patient is going to pull it out. When you pull it out, as I told, it's a small curved teeth turned backwards, isn't it? So like a blade like cut is going to cause. Okay, with a it'll be deep enough and little bit of bleeding will be there. This is how a classical rat bite looks like. Rat snake bite. Okay. Here also there for the classical thing is also non-venomous. Look at it. Classical one. This also scratch, it's a non-venomous. Here, small abrasion, nothing has happened there. The small abrasion inside that particular circle you can see, this is also non-venomous. Here also you can see scratches. Of course, in the finger, actual one scratch, it's a very recent one. So here also you can see that these are all the scratch marks. See, a patient is bitten on the nose. He was lying on the ground. He's bitten by a non-venomous thing. You can see the patchy marks on the nose with slight bleeding. And here also the right-hand side, you can see on the index finger, patchy like scratch markers. So these are all the non-venomous or snake bite. Again, non-venomous. See, patchy. In the finger also you'll get the blade like scratch marks on the thing. This is also non-venomous. Yes, again, once again, non-venomous. This is python bite. Okay, python is a non-venomous snake, very big snake it is. So it's got a very big mouth. So you can see the small teeth marks on the foot. But since it has a very big thing, it has some local reactions causes. There is some, you'll get edema with this particular thing. If it is bite the flesh, sometimes it is what you call, it'll take out the flesh. That also will be happening. But most of the time you'll get the python bite like this. But look at this. Okay, you can like a punctured wound, and a local manifestation already started. The one teeth has been entered very well, that you can see the bite mark. The second one is not that clear. Look at the distance, it's too far it is. So it's going to be a big rhesus viper bite it is. Only one bite mark has been taken, the other one is not clear. As I told, might be on the what you call footwear. The other one might be in the footwear. That's the reason only one bite mark can see. This is the pit viper poisoning. Classical, the 2 bite mark, and there is no much oozing. Okay, only 2 punctured wound, and you can see the local reactions what happened. This again, as I told, bulle in pit viper poisoning. It's the second day of the treatment. It's a bulle that you can see in case of a pit viper. See, only small 2. This is a cobra bite. Okay, only small bite mark with a little bit of blood oozing the thing. There is absolutely no other local symptoms you can see in this case. Here also again, it's a neurotoxic snakes, but of course you can see the small scratch there. So always don't imagine that most of the time it's small, because if a venomous snakes bite, it bites sometimes depending upon the area is where it's going to bite. Sometimes catch holds. So the teeth on the lower jaw sometimes have a abrasion like thing like. Okay, but of course it's seen the thing, but no, these are very commonly seen. There are possibility of the combination of all 2 things also possible. But this looks like you can see the thing is a venomous bite. This again 1 mark, second one is not quite clear. This also pit viper bite. Usually patient kills the snakes and get, that's the thing, we have the photographs of both of the things, the snakes as well as rhesus viper bite it is. You can see that the edema already started in the area where it have been bitten. These are the another very severe cases of snake bite where local necrosis already started, bleeding has been started, and you can see the changes what you can see. These are the poisonous snakes bite. Okay. So we have seen now 2 headings. One is how to identify the snakes if a patient gets, then looking at the bite marks. Third one is lab investigation. So there is no specific lab test for snake bite. Absolutely, we don't have presently in India, but there are some research are going on to have the thing. That's called ELISA test based on antigen in the venom. What is not that? How do the pregnancy test, etc. Okay, we take the blood of the patient, put it into the ELISA kit, so that depending upon the presence of that particular antigen in the bloodstream based on the venom of the snake, it's going to give a coloring. If that would have been established, we can have more easy access to the treatment part of the snake bite, because we can identify which particular snake's venom is there in the bloodstream. Okay, so that's a specific answer. But there is no market is not available in India, but of course some developed countries like Australia do have such a ELISA test for identify the snakes. Since they have different species, when you import that thing also, of course it's a costly affair, I cannot get a result out of it. But a lot of research are going on in Mysore is going on, as well as in Rajiv Gandhi Institute of Biotechnology in Trivandrum also they are working on this thing to have a ELISA test to identify the presence of which particular venom is present in the body based on the antigen reactions. But of course we do have some clinical trials here, but it's not 100% correct. Still works are going on. We do expect that within 5 to 5 years we'll get a ELISA test to diagnose the snake bite. Then it's going to be a boon to the human being. But what you then we depends upon the blood changes. As I told, when you start learning hemotoxic and neurotoxic. Hemotoxic snakes, if you bitten, they do have hemolysis. Okay, the blood won't going to be clotting. There will be destruction in the RBC, so there will be hemolysis will be there. The blood won't be clotting within the 3 to 6 minutes, the common what you call normal clotting time. To have that, we got a test called 20 minutes cold blood clotting test. It is WHO approved test called 20 minutes. Okay, so what we do that we'll take the arterial blood of the patient, put it in a small test tube, keep it in the room ambient temperature for 20 minutes. After that, just tilt the test tube. If the blood going to stay as a what you call a clot like thing, it's going to stay there. That show that the blood clotting is correct. If it's not clotting, there'll be oozing of the blood. You can see that from the test tube, blood will be flowing down. So that's called 20 minutes. But of course, we don't entirely depend because we will be wasting their 20 minutes to waiting for the clotting test. In our institution, we got our in-house diagnostic blood test we do have. Then urine examination, there will be hematuria, proteinuria. Of course, immediately you don't get it. After 6 to 8 hours, we get the thing. Then, of course, if you go to take the ECG of the patient, there will be changes will be there, but actually not connected with the snake bite, but it's because of the fright and other thing, they got only academic interest. So there is no specific, sometimes some local Vaidyas nearby, what you call snake healers, they'll send to our institution to do that. I am not able to manage, there will be venom in the blood, you have to go for the blood test to find out the thing. So presently we don't have absolutely any test to find the presence of the venom in the human body. So anyhow, we have completed the third one. We had identified the snakes, we are looking into the bite marks, then we have seen the lab investigation also. This is very important for a medico is concerned by looking at the local and systemic changes. Okay. So this is for the practical purpose, very most important. Look at there are the very commonly seen 5 local symptoms: local pain, tissue damage, swelling and burning pain. Look at cobra. They got minimal local pain, but tissue damage will be there, swelling will be minimal, burning pain will be minimal. But usually in such condition, cobra bite patient come to hospital because he got minimal discomfort. But look at the crite. There is no local pain, tissue damage will be there, no swelling, no burning pain. So patient usually won't come. As I told, it's a nocturnal snake. It bite. It has an affinity to enter inside our house and bite the person is sleeping on the ground. So it's the patient slightly scratches the area, he turns back, again he go to sleep. There the death will take place because he don't come to hospital because we don't have much more local discomfort. But rhesus viper and soft-scaled viper, there will be local pain will be there, tissue damage will be there, swelling will be there, burning pain will be there, then surely will come to the hospital. But in non-venomous bite, nothing will be there. There won't be local pain, there won't be tissue pain, there won't be swelling, there won't be burning pain. But if you can see the patient by means of fright, sometimes all the systemic manifestation will be having, but absolutely there won't be any local manifestation. And again, another this is 4 ways we look for. Another because systemic manifestation will be there, toxins, especially in neurological snakes. There, cobra there will be toxins, but hemostatics, abnormalities, renal complication won't be there. But emotional manifestation will be there in all snakes because patient have been seen the bite means he'll be get frightened. So then because of that we'll have emotional manifestation. Crite also toxins will be there, but rhesus viper is a yes with a question mark. As I told you that this classification is outdated. In rhesus viper, it's a hemotoxic snake, but sometimes the patient shows toxis-like symptoms. Okay, so that's how these symptoms are supposed to be understood. Then let's sum the. This is how we'll understand the snake. Then how we'll come to the management of the diagnosis. Okay. So the next part, in half an hour, I'll try to finish it off. How we'll do the management of the snakes. This management part will be based on the modern way of approach. Okay. So we got first aid. This is how we'll manage the snake bite. First aid is very important. Then specific therapy has to be given. Then supportive therapy or treatment for complications. If you have any complications, that will be treated up. The first aid of a snake bite itself is a very big topic. It will take more than 3 or 4 hours. I'll very briefly tell you that. WHO say that do it right. Okay. R stands for reassure the patient. As I told earlier, okay, non-venomous snakes also, because of emotional manifestation, patient will have all the signs of venomous bite. We have studied classics also. We have such a references for that. I think you want to learn the thing. So reassure the patient. R stands for. I stands for immobilize as a fractured limb. But actually in Indian condition is very, very difficult. Okay. Then get to hospital immediately. Then tell the doctor any systemic symptoms such as process, etc. is happening. Then you have to tell the doctor that. So first aid has to be do it right. So application of the constricted band. The first is nothing but the immediately what you do till we reaches to the center. What treatment? What are the idea? What are the procedure we do to the patient? What you call as a first aid, isn't it? So application of a constricted band, WHO and the Red Cross Society, etc., and the national protocol also say that we are not supposed to go for constricted band. Okay, why? Because these modalities have been framed based on WHO guideline, and in WHO guideline, the developed countries have more power on the thing how to frame the thing like. So they say that, but see, if in Australia, if a suspected snake bite, maximum is the 15 minutes, the patient will be airlifted to the nearby hospital. That's what is going to happen. But in Indian, in a rural village, it will almost take more than 20 hours to reach the nearby hospital. So what happened? Why they say that don't do the constricted band? If you do the constricted band not properly, there's a chances of local necrosis and the complications. Okay, so the WHO said that let the venom spread all over the body. We are going to neutralize with that of the antivenom. That's why they say that don't do the constricted band, because patient reaches the hospital within short time. But in Indian scenario, things are different. Okay, sometimes the patient has to be carried, especially in Orissa and other deep villages and all. Of course, near to the jungle where the people used to have the thing like. So they'll take a long time to bring them to hospital, more than 20 hours, etc. etc. We take it. So what we do say that do the constriction, let the local necrosis happen, we can manage it. We doesn't want to have the venom to be spread under 20 hours. By the time when you go to neutralize the thing, there won't be any venom, but the complications of the venom might would have been happened, the patient will die. Okay, this is what usually happens. So in Indian subcontinent, we do advocate to go for the constricted band, but it has to be done properly. Okay, 2 to 4 inch above the bite, it has to be 3 by 4 to 1.5 inch wide. Usually what happens now, when a patient gets a snake bite, the people will gather together, all are panic enough, whatever they do, they doesn't know. So I have seen the patient with a constricted 7 bands. She has got a small 14 years lady, girl, got a bite in the left foot thumb finger. Thumb, she got a bite. Of course, she was a non-venomous. Then when you come to the hospital, there was a one constricted band on the ankle. I started removing the thing. Then she says, sir, one more. Then I just, that she was wearing a pajama like thing. Then I removed the thing. I have seen 7 constricted band. I asked her who tied all these things. Then she told that people who are come over there, they'll say that tying is better. Then everyone started tying the thing. So that's what's going to happen. So that's not supposed to be the ideal way of tying the constricted band. If you do that thing, if it is a venomous snake, and again the complication of necrosis and tissue damage is compared to be very, very high. Then okay, so 1 inch wide it has supposed. People will to tie with the things whatever they get in their hand. Okay, with a telephonic wire, I have a thing. Telephonic, the wire that we transfer the thing, the telephonic thing like that. The wire I have seen a patient with thing. Then all whatever material we can, people can be used as a tying thing. They used to tie the thing. That's actually not the way of tying the thing. Then cutting and suction, better to not do that, because as I told that the diagnosis part is based upon the by inspecting into the fang marks, isn't it? So if you do with the cutting with the blade and all, the fang marks look like a scratch like thing. If might would have been a punctured wound, if you scratch with the blade and all, it will give an impression that it's a scratch. Then second thing, the material what they use for cutting and other things, isn't it? The old rusted blade and other things they do, rather than doing the help to the patient, they'll be complicating the things. Then suction, absolutely don't do the thing. Usually we have seen that people want to suck the thing. If a patient is bitten by the venomous snakes, if somebody sucks the thing, if he has an ulcer in the oral cavity, there's a chances of he is getting environmented with the venom. Of a very rare case, but there's a possibility. Washing the wound also better to not go for that. Never keep an ice pack. If you keep an ice pack, local tissue necrosis, because venom going to be stay there itself, local tissue necrosis is going to be very high. Analgesic and sedatives also never given. Then WHO say that you go for a pressure immobilization technique, but in Indian condition it's not quite clear. So this is how you're supposed to tie the thing. One in the site of bite, it will away, and it should be, not be that tight enough. And one more the other thing, only one thing wrong in this thing that it should be wide enough. What they're showing here is not that wider one. Okay, this is Indian Military Academy's first aid method. This is what you call pressure immobilization technique. Do you believe that, or do you think that we can do this? Because we are all panicked, we don't know. They say that it has to be handled how we handle a fractured limb. We doesn't know how to handle a fractured limb itself. But they say that with a crepe bandage like thing, the entire limbs, affected limb has to be bandaged once, then keep a rod like thing, another with a cloth, again you bandage the thing, then transfer the patient to the hospital. Okay, of course, we are supposed to propagate this, we are supposed to make the patient aware, this is how a suspected snake bite has to be, that what called pressure immobilization has to be done in a suspected snake bite. Then we'll go to the very shortly about specific therapies like anti-snake venom is available. It's called ASU. It's a polyvalent. As I told, we doesn't know which particular venom is running in the what you call circulating in the venom in the blood stream of the patient. So we are not able to identify which particular snake it is. So in India, as I told, that the 4 snakes are very common. These 4 snakes are venom will be collected, that will be injected to the horse. Then horse is going to become hyper-immunized. Then they produce antibody against the thing. This antibody will be collected and they'll made into the medicine. Looks very simple but very sophisticated procedure it is. This is how we'll produce anti-venom. So in India, we do have polyvalent. All 4 snakes venom will be injected. So if a patient is bitten by a Russell's viper, when you are giving polyvalent antivenom, unnecessarily we are pushing 3 more snakes antibody to the patients. That's how anaphylactic reaction is found to be very common. If you could able to, as I told, the ELISA test, okay, draw the venom, draw the blood of the patient, find out which specific venom is there. If it is kite venom, then only kite's monovalent can be injected. But since we don't have that diagnostic techniques, we cannot go for monovalent. Okay. Then these are produced in both liquid and lyophilized form, that's a powder form. Liquid ASU requires reliable cold chain and refrigeration. So in a village-like setup, sometimes you do have a difficulty in maintaining the liquid ASU. It is expressed in 2 years, but lyophilized ASU does not require a complete cold chain is not required for that. But what happened? Lyophilized ASU in a what you call powder form, they got more anaphylactic reaction. That's what our observation is. Okay. And as I say that a specific therapy is anti-snake venom, it's not a remedial medicine. What it does unbound, free-flowing venom will be neutralized by this particular ASV. That's only that does. So by the time the patient reaches the hospital, whatever the damage the venom done to the system has to be treated accordingly. This antivenom only neutralizes the venom in the bloodstream. So immediately if the patient reaches, you diagnose it very firstly, then immediately start the antivenom, then venom will be neutralized easily so that the damage that venom going to cause is comparatively comes down. Okay. This is how 1 vial of anti-snake venom and the serum looks like. It's very expensive. One is in the percentage cost 1,200 rupees will cost. Then ASV administration criteria, as I told, is a very costly medicine, rare as well as. So since it is a thing prepared or developed outside the human being, even though it's an antibody, when you inject to the human body, it works as an antigen, so it have the complications of anaphylactic reactions. So it has to be told that supposed to be given only the patient has systemic manifestation like evidence of coagulopathy. That means blood is not going to clotting within 3 to 6 minutes. If it is a hemotoxic snake bite, blood is not coagulating, then you can say that we are supposed to give the thing. And ptosis, in a neurotoxic snakes, if the ptosis is started, then you're supposed to give the thing. Then persistent and severe vomiting in the abdominal pain will be there when you're supposed to give the things. Okay. Then the local manifestation like local swelling, which involves more than half of the affected limb, then you're supposed to give the antivenom. Then rapid extension of the swelling also is supposed to give the antivenom. Then how to fix the dosage of it? As I told, something prepared outside the human being, isn't it? So it will have a chances of anaphylactic reaction. We'll slowly supposed to start the thing. We'll give an infusion way or liquid. As such, we can dilute with the depending upon the body weight. Then if it is a lyophilized, it is have been diluted with the 5 to 10 ml per body weight of the isotonic saline. We are going to mix the antivenom with the thing. Okay. Then in isotonic saline, intravenous injection at 20 ml per minute. Of course, we'll count the drops. That's how it should do the thing. The very drops weight is supposed to be given. And in olden days, the local administration of ASV has been given. At the site of bite, they used to inject the antivenom as such directly, but it is found to be non-effective at all. Rather than helping the patient, we are producing there some local injuries which might bleed if you not treat it properly. Okay, so we are rather than helping, we are creating some more bleeding points if you are injecting the antivenom to the affected bite mark, affected nearby area. So not supposed to go for that. And does it require any test dose? Absolutely no. Because if you venom in the body, it has to be neutralized. For that, you're supposed to give the antivenom at all. Supposed to be given. If not, if you give antivenom, we'll have the venomous effect of it. So, no predictive value in detecting anaphylactic reaction, isn't it? So there's no use of it testing the thing. If patient is having anaphylactic reaction with the anti-ASV, then it has to be managed accordingly. Then it's supposed to give the antivenom, because our purpose is to neutralize the venom. That's why sometimes the death become inevitable. Patient will be very much anaphylactic reaction, will be showing to the anaphylactic reaction. We are not in a position to push the antivenom. If you are not giving the thing, patient will die. If you give the antivenom, because of the anaphylactic reaction, also patient sometimes will die. So this is what, in some cases, the death going to become inevitable. To prevent the anti-ASV reactions, what if you do 100 mg of hydrocortisone, antihistamine will be given at the starting thing. Then usually seen complications are urticaria will be there, itching will be there, feverish patient feel, shaking, chills will be there, nausea will be there, vomiting will be there, abdominal cramps, tachycardia, hypotension, bronchospasm, patient won't able to breathe properly. So such a what will do that? Will stop giving antivenom. Okay, because antivenom causing that anaphylactic reaction. Then we are supposed to go for 1:1000 adrenal is given. Then after some time patient will recover. Again we start to give the antivenom. This is like a what you call cat and mouse play like things has to be given. So sometimes the patient doesn't show any reaction, so that we can keep on pushing the antivenom. So it's going to neutralize the venom thing. You even have seen up to 15 vial, the patient was comfortable. There was no anaphylactic reaction at all. But in the 16th vial, patient started to show very severe anaphylactic reaction. So that is unpredictable on the situation. Then we just started giving antivenom at the period of 3 hours, and again in the period of 3 hours, another set of saline, we are giving the antivenom. So gradually, the blood usually returns to normal. Within 6 hours, the blood is going to become protein if it's a hemotoxic snake bite. Then urine become to normal color. Spontaneous bleeding, if anything is there, they are going to stop. If a shocked patient, of course, blood pressure may increase after 30 minutes. Then complications, of course, that if you give antivenom, patient going to recover, of course, we can stop the treatment. But sometimes you get the complications. There are delayed manifestation. Of course, this is very rarely seen condition. Patient come to hospital with a suspected snake bite. We are going to diagnose it as a venomous snake bite, but there won't be any clinical symptoms at all. We will discharge the patient after 24 hours or 48 hours of observation. There are cases are reported that after going home, after 7 days, suddenly patient collapsed and died. So nobody knows what's the thing. So there is a hypothesis based on the thing that the venom going to stay in the body as a blob-like thing. It's going to burst out, but very rare it is. But of course, even have the experience, because whenever go to take classes and all, usually people come and say such stories. There so and so got the snake bite, they went to hospital, 24 hours to 48 hours observation, nothing was there, came back. After 1 week, suddenly they collapsed and died. 3 such cases I have listened. But since they believe that it's going to be a normal life, they didn't go for a postmortem, so they doesn't know what might be the causes of death in that cases. But there is a very rare phenomenon where the possibility of the venom going to stay in the blood and burst opening after a very long time, but very rare it is. Only for information. Then the treatment, as I told, that if a massive bleeding is there, then fresh whole blood has to be given. If a shock is there, then volume expanders including plasma blood has to be given. Respiratory failure, of course, mechanical ventilation. And commonly in hemotoxic snakes, you will get ARF, acute renal failure, then hemodialysis has to be done. There are long-time manifestations we see, especially this can be managed very well with Ayurvedic treatment. There will be edema, will be there, usually resolves within 2 to 3 weeks. And textbooks say that, modern textbooks say that they may occasionally persist after same time, and sometimes they may not respond to treatment. This is a what you call quotation from a modern textbook. But I can tell you that with an Ayurvedic treatment, we can manage this edema very well. Then if a coagulation disturbances may persist beyond 3 weeks, especially short-scaled viper, there will be a coagulation disturbances. That also with Ayurvedic treatment we can manage very well. Then altered sensation of taste will be there, neurological cases. Then there's a chronic ulcer. As I told you, if first aid is not done properly and not treated properly, there will be chances of a chronic ulcers. This chronic ulcer also, with Ayurvedic treatment, we can manage very well. These are some photographs of chronic ulcer as a complication. Will be long-term complication we can see in rhesus viper. Of course, if you get an ulcer like this, when the patient should have the patients, treating doctor should have the patients, when nursing staff should have, because every day we are going to scrape it out so that until you will get the good granulation tissues. With an Ayurvedic Vranahara, Dushta Vranahara, Vishahara, Dushivira Shahara, our property, we can treat these conditions. Okay. Of course, this is already healed case. Look at this case 1. Okay. This is a snake bite. So gradually, every day we're going to treat the things like almost healed. But of course, it took almost more than 3 months. See, almost it is healed. This is another one. Okay. This case have been recently published in an article. Okay. Journal of Ayurvedic Case Studies, published by Indian Institute of Ayurveda. In my name, recent edition, it has come. You can go to that particular article journal. When you have a journal review, if you have, just go to that. Everything, what treatment protocol we have followed, I have enlisted in that. Okay. But with that, very gradually, the things have been, granulation tissues are coming. We can manage the case. Okay, we could able to save the fruit of this problem. And this case, actually, it is in the medical college. Of course, the case might have been treated by the nearby medical college. The patient was 60 plus with the diabetic. Okay, so they could not able to manage. They told amputation is the only way. Then he came for Ayurvedic treatment, and within 2 months, we could able to have very good result in this particular case. Okay, so these are in brief. Okay, as a beginner, how you want to identify the snake, how you are supposed to do the diagnosis, and how to be supposed to treat the snakes. Okay, I think in 1.5 hours we have learned about the thing, and you got any question on this particular topic, we can discuss it. Yes, anyone please. Hello.
Hello, sir.
All right.
Sir, thank you for an enlightening session. So it was truly, you have reduced the burden of us. It was really informative and it was really a live session, sir. Thank you so much. Now we request all the participants to share their query in the chat box. Dear delegates, if you have any queries, you can post it in the chat box, and the delegates who have joined live with us on YouTube also can share their queries in our group, Abhijna group. It was truly a delight listening to you after a very long time, sir. I have been your students. We had been posted to Abhijna Chikitsa. Me and Dr. Neeraj were there.
Excellent.
Dr. Neeraj was your alumni, sir. So we had a great time with you then.
Okay, thank you.
It was really great listening to you after a very long time, sir.
Okay, welcome.
Thank you so much, sir. Sir, there is a question from Prerana, Dr. Prerana, I guess. Sir, what exactly Ayurvedic treatment can be given in poisonous snake bite?
All right. Okay, in poisonous snake bite, usually is to be treated with, can be treated with an Ayurvedic protocol only. But nowadays, what's the issue that since we don't have the acceptance from the society, because when a patient comes to the hospital, if it is a very much medical emergency, people look for life-saving mechanism, otherwise we call instruments in the hospital. Okay, like what you call mechanical ventilation, etc., etc., etc. But when it comes to the reality, the death rate in both the hospital, in an Ayurveda hospital or Ayurveda hospital with a minimum facility, in a sophisticated medical college with a life-saving facility, both are looks alike. Okay. So in Ayurveda, we do have different way of approaches depending upon the snakes, etc., etc. The main hurdle what we have nowadays is that the availability of the medicine. Okay. Taruna Bhaskaram, Jiva Raksha, etc., etc. medicines are very popularly used in olden days. Okay. Still in Papanisheri, we used to treat the case with the Ayurvedic protocol in the beginning year, 1960s and all. But still, as I told, the social acceptance is important. If anything happens in your clinic or an Ayurvedic hospital, people believe that they don't have the sophisticated machinery to save the life of the patient. That's taken place. So that's going to be a very big issue, isn't it? But the same thing happens, as I told, in antivenom, when we giving the thing, there is a possibility of anaphylactic reaction. Patient sometimes death going to be inevitable at all. But the society believe that they did their level best. Okay, then they could not able to save. That is acceptable in a medical college, but in Ayurvedic hospital, it is not accepted by the thing. That's what nowadays we are not taking much risk about that condition. But of course, Ayurvedic treatment protocol explained in Prayoga Samuchayam as well as Kriya Kaumadi like books are there. So we can, I think, of course, a very big topic, what are the protocol like thing, but depending upon the different snakes, we got different modalities as to be thing. But in Papinicheri, as I told, the pit viper, we are treating, till now we are treating without antivenom. In allopathic hospital, they'll give the antivenom, but in Papinicheri, we don't give antivenom. All Ayurvedic modalities, we are able to treat the conditions. So as a practitioner, my suggestion to all the people that you don't bother about giving antivenom and treating the things. As a practitioner at your place, you develop a culture that if any suspected snake bite comes to your place, you diagnose it properly with the venomous or non-venomous. If it is venomous, do the first aid correctly, then refer the patient to higher center. That much enough and an Ayurveda physician is concerned. If it is non-venomous, if you are confident enough, patient also have faith in you, I think without sending the nearby center, we can treat the condition very well. Okay, that's what we need, that's enough. So do the first aid correctly. If it's venomous, refer to the patient. Don't treat that, I don't say that, don't treat like, but of course, don't take the much risk about it. But if you're confident, we can go the thing, but you need more exposure. If anyone want how, we can, most of you are welcome to Papinicheri, where you can learn the thing, how we manage, so that if you are confident enough, you can manage. Otherwise, as a practitioner's view, better to educate the patient and do the needful, what they actually need in that particular condition. Okay.
Thank you, sir. There is one more query by Tejaswini. That is, sir, Ayurveda has that Arishta Bandhana is a treatment, but WHO is not agreeing with or not told about it.
Yeah.
So which one we are supposed to obey?
Okay, I think in the presentation I have explained it. So Arishta Bandhana is explained Ayurveda. It is a constricted band, but in that chapter itself is told that what material has to be taken, how it has to be done. We are not doing that. That's the issue. So it should be soft enough. It should not be tight enough to cut short the arterial supply. See, that's the idea. That's why they say that it should be tight enough so that the index finger can be inserted in with that. Just not be tight enough, because venom will be spreading entire body through lymphatic channel as well as venomous drainage. Okay, so we have to believe that when you have a constricted band, the people going to tie it in such a tight that the arterial blood supply to the part also going to cut off. Okay, it should not be. That's why they say that it will loose enough. And the material what we use, if it is venous drainage is cut off, okay, then nothing will happen. Okay, but the arterial supply also cut off, then there will be a chances of necrosis. Then that will be end up with whatever we seen, that big ulcers like thing will be manifest. Sometimes you might need an amputation also. So Arishta Bandhana, as I told, WHO say because they have a what you call developed countries are more bargaining capacity on formulating in the protocol. So there, as I told, that 15 minutes maximum, patient will be airlifted to the nearby hospital. So they'll give immediately antivenom, they'll neutralize the venom. So they say they're not good in managing the, I can say that they go to only, they have the reason, remedy of amputation only if necrosis happen too much. But in the condition, as I told, within 15 minutes, of course, in citizen it's possible, but usually poor, what can call people in the villages who's a daily wager, they're going to get a snake bite. Especially Orissa, last time I met a sir, he was telling that it will take more than 18 hours to transport the patient to nearby hospital. That time, if you don't do the constricted band, the chances of spreading the venom in the entire body and damaging the vital organs and complications are found to be very high. So in that condition, we advocate them go for constricted band, but it should be tied in a proper way. That as an Ayurvedic practitioner or as a medico, we should educate the people how to tie the band properly. If band is tied properly, we don't have any complication at all. That is in Indian subcontinent. This is what ideal I do believe. Okay.
Sir, there is another query. importance of Visha according to time of bite.
Okay, importance of Visha according to time of bite in these two aspects of the thing. First thing, as I told, in Kriya Kaumadi, otherwise in Prayoga Samachaya Malayalam books, there are different things have been explained. If a snake's bite at different place, what will happen? In Shushuda Kalpasan also will get that particular quotation, isn't it? Aharartham, Bayartham, these are the things. So, if the patient, if a snake's bites a snake before Aharartham, in that condition, if you think that it's a foodstuff or the prey, it's going to bite the thing. So, if it is immediately after echidiasis, as I told, the what you call removal of the outer skin of the snakes, by the time of almost 2 weeks, the snakes cannot have a better visibility. So, it might be hungry enough. So, that time if it bites, the quantity of venom injected will be high enough that will have more fatality chances are there. Okay, and at the same time, it's a very small, what can I call, the prey, supposed to be a human being, is very children or age-old people, then also it's going to be chances of injecting the venom will be more. So it's a Visha time in the sense that how much quantity of venom is injected. That depends upon all these parts. And if a morning hours also, the venom if injected is found to be a little bit more, that's sort of observation, more complicated it will be. So it depends upon the host as well as the prey, as well as the nature of the snakes, as well as the area of the snakes, how much time they took to taken to come to hospital. All these matters. But what classic says till now also holds good. So these are the things you're supposed to keep it in mind.
Sir, one more query from Usha D. What is the practicality of 24 Upakramas in current time?
Right. So in the current time, among the 24 Upakramas, some of them are, we can say that first aid methods, some of them are complete intervention, some of them looks to be mantra, etc., superstition we can call nowadays, but of course it's not proven until and unless we doesn't know much about it, we are not going to comment on the thing. But of course, in that we can categorize that 24 Upakrama. If you are a PG scholar, very well you can categorize, try to on the thing, how we can categorize all these things. One is intervention, one is Aushadha, then another one is the first aid method, that we can say that. So the Aushadha, if you are preparing correctly with the thing, you do have a very important role. And first aid method, what you told, some of the things are there. That also holds very good in present condition. But in that also, Achushana have been told. But Acharya say that when you go for Achushana, your mouth has to be smeared with the ghee. Otherwise, it should be some, what you can call, duff-like thing has to be kept. The idea behind that, if a person is going to Achushana, if you take us the venom, unfortunately, if venom comes out from the wound, very less chances are there. If a patient has an ulcer, you'll get venomous manifestation. To avoid that, Acharyas have told the thing. So these are the things logically we are supposed to analyze, because in the present condition, the development of modern medicine and modern understanding, we got better way of doing the things. So why can't we go for that? That was we need actually. The ultimate aim of us is to prevent the complication that we're going to cause to the person who has bitten. So if a modern facility, it is good, it is logically looks better than what classics without 2000 years back written, we can adopt the things, there's no doubt, there's no what you can call wrong in that. Okay. So 24 Upakramas nowadays, to conclude in a nutshell, I can say that we got limitations, but understand that properly, understand the logic behind that, then which can be adopted, which does not cause any harm to the patient, that can be done. Okay.
Sir, one more query is there, sir.
Yes.
What is your opinion on why Ratri Jagarana is indicated in Visha cases other than not for missing symptoms?
Yes, another important question. Okay. Usually we have believed that if a patient is bitten by the snakes, he is not supposed to be allowed to sleep. Okay. I have seen the thing, cases like. But now in the classic, I do believe that I have not gone through that. Classic have been told that you are supposed to make and is kept Jagarana or allowed. In my knowledge, I don't know. If you have, we'll go to that. You know. But I do believe that this also, I told that we're going to analyze that in logically. Why? Because all the Upakramas explained in the classics, apart from that, Vega Anusara Chikitsa is explained in the classics. Vega Anusara Lakshanas also explained in the classics. When you look into that, we can say that all the Lakshanas are explained are subjective. That means the patient should awaken to explain to the Vaidya what is happening to him. All are subjective parameters. To get that subjective parameter in a sleeping person, you cannot elicit the subjective parameters. So they told that patient is supposed to be asked to jagarana or awakened, so that the Vaidya will get the what happening in his body regarding all the subjective parameters. If toss is happening, if patient is sleeping, you cannot differentiate it. Okay, if allowed to sleep, if process is not. If the patient is made to awaken, then you're going to tell the Vaidya that, doctor, I am not able to hold the what you call that's what toss is going to happening. So eyelid not in I am not to hold the eyelid in a position. So that's the reason the subjective parameter which can be elicited only if the patient is awakened. One thing. Second one, if you allow the patient to sleep, if somebody, as I told, there will be emotional manifestation. Surely you're going to see a nightmare. I mean, what you call dream. So you'll be seeing that you're going to die, or you're again going to be eaten by the snakes. You'll get up with a nightmare, with a shouting, isn't it? And all of us, one or the other way in our lifespan, we might have been experienced a nightmare. How will get up? When you get up, our respiration going to be increases, our heartbeat going to be increases, we're going to sweat the thing, etc., etc. If that happens, again we are creating the venom to spread again fast, isn't it? These are the might be the research. The Vaidyas might would have been told that not to sleep, though if a patient is bitten by the snakes, so that to avoid these things. But in modern analysis, when you logically analyze, if a patient go to sleep, its respiratory rate comes down, its heart rate comes down, that is better to avoid the spreading of the vein. Okay, so this is what logically we can analyze the thing. So to elicit the subjective parameters, ancestors told that not to sleep. Okay.
Thank you, sir. Sir, one more query. As setting up an Agadatantra OPD has been added as a new thing to the new curriculum.
Yeah.
Sir, what could be, as you are running a successful Agadatantra OPD, what could be your guidance if we have to set up an OPD? First thing. Second question is, sir, adding dermatology as a scope for Agadatantra, which has been, I think, removed. Even in Kerala practice, we see dermatology as a part and parcel of Agadatantra practice, which has not been included in the curriculum, NCIS curriculum. So what is your opinion?
So let me answer the second one first. Okay. Being a Rasashastra person, I say that dermatology is a Rasashastra speciality. Am I right? No. Is it? But okay. So it's a dermatology, of course, one not among the Ashtangas of Ayurveda, and all we are now running behind the dermatology. Dermatological cases, if you have a approach through Agadatantra, otherwise through the concept of Visha, the success rate is high. Okay. If you had any Dushi Vishari Agadam or Vilvadi Guliga or Arogya Vardhini, etc. drug in your prescription, the same prescription what a Chikitsa teacher might would have been written. Along with that, if you add one more thing, surely you'll get a better result. Okay. So understanding dermatological condition in the purview of Agadatantra gives you a higher rank. There's no doubt on that, isn't it? Because a lot of venom, not poison, weak poison, Dushi Visham, etc., involved in dermatological conditions. So that way of understanding the thing through Agadatantra gives better result. But there's no need for that. Only Agadatantra teacher have that approach. Even a Chikitsa teacher, you're treating the cases of dermatological condition very well. If you have an approach towards Agadatantra way of thing, you can also treat that. So being a Rasashastra people, of course, I have my PG in Rasashastra, so we'll have better understanding about the yogas. When you analyze the yoga, okay, look at that. Whatever the yoga explained for skin condition, Kushta Adhigara, you can see one or the other Visha will be an indication for that condition. That way you analyze the yoga, then you can have that. That's what. If you add Dushi Vishari Guliga, otherwise Arogya Vardhini, if in the cases of a psoriasis-like condition, surely you'll get the better result. So that's the second part of the question. So it's not anybody's speciality, we can say dermatology. Anyone can practice dermatology, but your approach through Agadatantra gives you a higher rank. There's no doubt on that. Okay. Second one, to start up a Agadatantra speciality OP, of course, OP basic things you're supposed to need. Immediately patient never come to you. Okay. When I tell you, I was working more than 10 years in Papanisheri Vishwaswara Kendram, people nearby my locality all know that I am the doctor over there. I tell you two incidents. One Sunday, when I was sitting at home in the afternoon, a patient came with a suspected snake bite. Okay. I looked into that. and that looks like a non-venomous snake bite. What we do in our center, I'll give given Nilvadi Guliga, I given to him. Then I told him that nothing to worry, you can go back home. Excuse me. Okay, I can go back. But looking at my face, the patient said, doctor, better can I go to Papiniseri and have another opinion? He know that I am the doctor over there, right? I am advising him to go back, it's a non-bite. If I am sitting at Papiniseri selling same thing, might would have been gone back. But since in my house, you are not ready to accept. That's the thing, that's important of the center. The center, an year of 60 years, have what call developed that particular name and faith in the people. So immediately if you start the treatment, nobody going to come to you, right? That's the reality. But if you get a patient, immediately because seeing the condition and referring, you just see the thing, diagnose it properly, teach them what exactly happening. Then if you refer, okay, then you can get the faith in the patient. The faith of the patient is going to be important. So such a snake bite and other thing, as I told that it's a very emergency condition. You don't start treating immediately. You diagnose the thing venomous or non-venomous. If non-venomous, do the first aid, do the treatment, then convince the patient. If it's okay, 1 or 2 cases gradually get, then gradually can develop, but it's going to be a long procedure. Within 1 year, you cannot have a 20 to 30 suspected snake bite case visiting your OPD, right? If you're venomous, of course, do the first aid, then refer the thing. If referring also is not a bad thing. If you are a good referring doctor, patient will have the faith in you. They say that the doctor know when to refer the patient correctly. Then treat with the dermatological. If you are good in that, you can start treating dermatology and other Kita, Lutha, Vishas, where also you will get dermatological condition. I think that which does not have a medical emergency, we can manage the thing. So the gradual process it is. First thing, educate the people regarding in your locality, nearby your hospital or college, whatever it may be. Such treatments are available there. So people gradually they start coming up depending upon your expertise and how we manage the cases. But of course, I don't think so. 6 months you will get a 30 number of cases, absolutely not. But gradually you can double. After a period of 5 or 10 years, imagine 1938, what, 25 or 35, what will be the status of the Agadatantra OPD in your hospital or college hospital. That way you plan it and gradually start working. I think that gradually it will develop. Okay.
Thank you, sir. Sir, there are 2 more queries. In Ratri Jagarana, Vata increase, and we know Vata and Vishaguna are similar. So, is that so?
No, of course, that's what I told you. That Jagana increases the Vata, there's chances of again spreading. But to know the Vega Anusara Lakshana, based on that, we do Vega Anusara Chikitsa. That's thing, and the subjects, all things are subjective. Patient awakened only, we can get what exactly happening to you. That's the reason it has been told. But nowadays, of course, in our practice, we don't make the patient to do the Dhatu Jagarana. Okay.
Sir,
the Latu Uksha Guna of Vata, both similar to that of Visha. Right.
Okay, sir. Sir, one more query, Dr. Mamta Shri. How Dundubi Swaniya Kalpa going to work in Visha condition?
Which one?
How Dundubi Swaniya Kalpa is going to work in Visha condition?
Alright. The Dundubi Dhwani, this all I tell you though. The first aid we say that reassure the patient, isn't it? So logically only we can answer thing. I don't have a classical answer for that. So these are all the things what explain in the classics, as I told, among the Upadam, Chadrumshada, Vimshati, Upakramas, etc. Most of the things look to consoling the patient. Okay. If you listen that, okay, I have written that Dundubi, that sound like, etc. And sometimes they say they smear with some medicated things and then you blow the thing, etc. I've been told in some books. So that reassures the patient that, okay, I'm going to be all right. That belief itself, sometimes if it's a non-venomous bite, nothing won't happen. If venomous bite also, if it's not going to be that much anxious because you have a belief that, okay, this is going to help me, that might be helping him. I think that's only timing I can answer. I don't think so. Apart from that, so these are things can be answered only with logical things. So you also think of any other thing like logical, it can be answered. That way it can be, isn't it?
Yes, sir. Thank you, sir. Here we end. I think we have no more questions, sir. Thank you for all your support, enlightening speech, sir. It was great listening to you. We henceforward look forward to have you and in other platforms too. Thank you for all the support, sir. Thank you, sir.
Okay, thank you. Thank you very much.
Here we end our morning session. We'll get back to you in the afternoon at 2 p.m. All the delegates are requested to join us back at 2 p.m. Thank you.
ಮಾಡಿ ಅನ್ಸುತ್ತೆ. ನೀವು ಮೀಟಿಂಗ್ ಸ್ಟಾರ್ಟ್ ಮಾಡಿದ್ರಾ? ಮೀಟಿಂಗ್ ಲಿಂಕ್ ಬೇರೆ ಅಲ್ಲ. ನೋಡಿ. ಯಾರನ್ನು ಎಂಟ್ರಿ ಮಾಡಬೇಡಿ, ಒಂದು ನಿಮಿಷ ಸೆಟ್ ಮಾಡಿ ಮತ್ತೆ ಎಂಟ್ರಿ ಮಾಡಿ. ಎಲ್ಲರೂ ಸೇರಿಸಿ ಆಯ್ತಾ? ಸೆಟ್ ಮಾಡಿ ಮತ್ತೆ ಎಲ್ಲ ಮಾಡೋದಲ್ಲಪ್ಪ. ಸರಿ ಸರಿ, ಇರಲಿ ಅವ್ರು ಇರಲಿ. 6 ಮೆಂಬರ್ಸ್ ಇದ್ದವ್ರು ಇರಲಿ. ಫರ್ದರ್ ಅಡ್ಮಿಟ್ ಮಾಡಿ ಒಂದು 5 minutes ಪ್ಲೀಸ್ ಸೆಟ್. ಯಾವ್ದು ಲಿಂಕ್? ಸೇಮ್ ಲಿಂಕಾ? ಸೆಷನ್ ಬರ್ತಾ ಇದೆಯಾ? ಸ್ಟ್ರೀಮ್ ಆಗ್ತಾ ಇದೆ ಹಾಗಾದ್ರೆ. ಇಲ್ಲ ಆಯ್ತು, ಆಗ್ತಾ ಉಂಟು. ಅದೇ ಸ್ಟ್ರೀಮ್ ಆಗ್ತಾ ಉಂಟು. ಒಂದ್ಸತಿ ಇನ್ನು ಬೇರೆಯವರಿಗೆ ಅದೇ ಲಿಂಕ್ ಈಗ ಇಲ್ಲಿ ಇಲ್ಲಾದ್ರೆ ಬ್ಲೂಟೂತ್ ಇರ್ಬೋದು, ನಾನು ಆಫ್ ಮಾಡಿದ್ದು. ಈಗ ಕೇಳ್ತಾ ಇದ್ದೀನಿ.
ಅಲ್ಲ, ಇಲ್ಲಿ ಮೈಕ್ ಆನ್ ಆಗ್ತದೆ ನನಗೆ.
ಮೈಕ್ ಆಫ್ ಮಾಡಿ ಮಾಡ್ತಾರೆ.
ಅಲ್ಲ ಬೇಡ, ಉಂಟಲ್ಲ ಮೈಕ್. ಅಲ್ಲ, ಸ್ಟೇಷನ್ ಸ್ಟಾರ್ಟ್ ಆಗ್ತದೆ. ನಮ್ಗೆ ಅಲ್ಲಿ 2ನೇ ಕ್ಲಾಸ್
Am I audible?
Yes, please.
and welcome back everyone. Let's now resume with the post scientific sessions of our National Level Online CME Series Volume 2 Visha Chikitsa, organized by Sri Dharmasthala Manjunatheshwara College of Ayurveda, Hospital and Research Center, Kutpadi, Udupi, in collaboration with Ayush Federation of India, Udupi IQAC, and Department of PG Studies in Agadatantra, Evum, Vidhi, Vaidyaka. Now, I take the privilege to introduce our esteemed resource person for this session, Dr. Srinidhi R. Sir, who will be enlightening us on the crucial topic of community preparedness for snake bite. Sir has completed his BAMS from esteemed College of Ayurveda, Udupi, and post-graduation in Rasashastra and Bhaishaja Kalpana from Taranath Government Ayurvedic Medical College, Bellary. Sir has been part of extramural research projects in Ayurveda practices and also has been a part of RGOHS project. Now let's lend our ears to the knowledge delivered by our esteemed resource person, Dr. Srinidhi sir. Over to you, sir.
Thank you, Dr. Kavya. So today we are going to discuss on the topic community preparedness for snake bite. What every doctor should know. So the thing is, as we discussed earlier by our eminent professor, Dr. Muralidhar sir, she has elaborately explained regarding the management techniques of snake bite and how agile a person should be or a doctor should be during the management of snake bite. So today we will discuss the different aspects of community preparedness for snake bite. So before introducing into the topic, I got a call from a person stating that my child was bitten by something one evening when the child was in outdoor, and he sent me a photograph stating that please diagnose or please guide me what to do. Now, after carefully examining the things, I saw that there are some bite marks or fang marks to be said, and then so I guided them regarding what next steps to be taken there. Now the story of two dots will continue further on. Now, before entering into the topic, the gravity of this management of snake bite will let know. The silent epidemic, India's burden. Now, the snake bite, even though it's generally unreported one, but WHO has categorically said that one, it is a neglected disease. In the sense, the incidence is more, still it has been neglected by different people. And when we go with the statistics, as we discussed, as the sir said, the bite cases range around 1,40,000 per year, and 58,000 death happens every year. And there are aftermath, there will be disabilities and so on and so forth. So India accounts for 1.2 million bites, 58,000 deaths, and 1,40,000 disabilities annually. So rural populations most affected. Primary impacts agriculture workers and barefoot children, and then again there will be less incidences, there will be increased incidences. The monsoon season peak, that is generally between June to September, the majority of the bite happens there. So accordingly, the adaptation or the doctor should be well aware when he should be agile, when should be very active in this regard. And moreover, just like the very much publicized communicable diseases, this doesn't draw much attention. Why? Because it is going to affect the rural population most, and then lot of cases are unreported one. So due to which the government is unable to take energetic steps in the management of these bite cases. And moreover, if a proper management is done, 90% of death can be prevented. We will see that in a snapshot regarding the prevalence of snake bite in entire India. So there are few red zones wherein there is a frequent interactions of these snakes with the humans, and then the death cases are reported more, and there are few areas wherein the incidence is less. Likewise, in case of Karnataka, there are few coastal belts wherein the incidences are more, and also in the farmland area, the incidences are more. As we discussed, as we said, that one, the snakebite incidences are seasonal, peaking during monsoon. Now, coming to the who is at the risk. As we know that one, outdoor workers like farmers, plantation workers, wood collectors, barefoot children, vulnerable due to lack of protective footwear, nighttime activities like open defecation and fieldwork after dark, monsoon and harvest, high risk seasons for increased snake activity. Now we can see that one, there are geographical vulnerability. Few professions, they come in direct contact with the snake habitat, and then due to which there is a every increased incidence of them getting envenomation. Now for that, because of improper knowledge, because of lack of management techniques, the death increases. Also because of poor healthcare system and lot other factors, due to which the death toll raises. Now coming to the positive factor, as we know that there are common venomous snakes, also we stated as a big four snakes. Now this includes Indian cobra, common crate, Russell's viper, saw-scaled viper. The venom can be neurotoxic, hemotoxic, or mixed, when cytotoxic in nature. So based upon that, the symptoms start manifesting. Now the thing is, generally when we understand the behavior of these snakes, they are shy in nature. They try to ward off from humans, but they bite the humans defensively, or when accidentally we step on them or as such. So we need to be very careful while uh, interacting with the snakes as such. And also the thing is, regarding the common venomous snakes, here the education or knowledge plays a crucial role. As a doctor, we have also the one more role is a public hero. We need to educate the public with regards to that of the poisonous snakes and their general features, how their appearance, what are their nature, and so on and so forth. Just to educate them, and then be cautious regarding when they interact with these snakes. So when the general public are well educated with these kind of snakes, they can easily prevent envenomation. Now this is the typical pathway of any snake bite case. Bite happens. Now as soon as the bite happens, the fear shoots in, and then what happens? The multiple persons involved, and due to half knowledge or having improper knowledge in such conditions, he may induce wrong first aid in such conditions. That may, one thing, it may delay the person from getting the proper treatment. Also it may, the fatality may increase, or the complications may rise, so due to delay in getting the proper treatment. So this is a challenge the doctor faces during any kind of snake bite. So here we can tackle these by proper educating the common man regarding the bites, and then what to be done, what not to be done, and then how quickly he need to approach any of the PHCs or hospitals wherever he can get the energetic treatment, so on and so forth, so that further on he can increase, or the successful rate of the treatment can be increased, and also the complications can be minimized. The golden hour, critical hour for first aid and transport to medical facility. So when the person has been brought to the hospital timely, 50% of the death can be easily avoided. So life saved by simple, correct initial steps. So timely intervention dramatically improves outcomes. The golden hour is often lost due to myths and transport delays. Here again, the doctor must educate on correct referral and first aid. Now, coming to the important point, why community preparedness is required. The first and foremost is preventing fatalities. 70% of the death occur before reaching a hospital. As we know that earlier, a faulty administration of first aid or some delay, all such, it will prevent the person who is a victim getting the proper treatment. In such incidences, we can, when we know the cause of the death, we can easily prevent that one. Addressing delays. So we should rush as soon as the person was bitten by a snake. And doctors' role are crucial in training communities for safe first response, and then integrated approach combining traditional Ayurveda and modern medicine for rescue, as a lot of research is carried out regarding the role of Ayurveda that can be considered after proper research. Community awareness, the first line of defense. Why? Because at the site of incidents, there will be general public, and they have to handle the situation properly. So their awareness is a utmost important. Identify risk, pinpoint high risk areas and times for snake bite, as we discussed. So during night, during monsoon, etc., all such conditions, or the person traveling in barefoot, etc., in bush areas, wherein this is natural habit of snakes. This is a high risk area that need to be identified, and the people should be very careful while going through those things. IEC activities, information, education, communication. By using leaflets, street play, village meetings for education, we can educate the general public regarding the bite scenarios, etc., and then management techniques, so that the error can be rectified and the person will be getting a proper treatment. Targeted training, educate school children, farmers and forest workers. Why? Because they used to, in day out basis or daily basis, they used to interact with these snake habitat, due to which they are the primary targets. So due to which we need to educate them. Even school children, while playing in outfield, etc., every possibility that they may get bitten, and because of that fear of getting scolding from the parents or teachers, they may hide the things and they may succumb to death because of that. Now this regarding the essential community first aid kit. It has to be there in case of management. So elastic bandage, clean cloth, antiseptic, splint is a thing to be needed there. And then a standard operating procedure will be a helpful one. Now coming to the snakebite management, a comprehensive approach. So Muralidhar sir has already elaborately discussed regarding the approach with regards to that of the snakebite management. We will discuss the first step, what to do. As you know that whenever the person was bitten by a snake, he will be very nervous, he will panic. So due to which his heart rate increases. So accordingly, we need to reassure victim, keep calm and still to slow down the venom spread. So make him calm and still so that the venom spread can be mitigated or slow down. And then immobilize limb. One more important aspect regarding things, we can make use of splint or sling effect limb at or below heart level, and see that the limb is below the heart level, and make use of splint so that the movement can be restricted. Remove constricting items, take off rings, watches and tight clothing immediately. Why? Because at times the venom may consisting of cytotoxic in nature, due to which there will be swelling, and then the person will end up in compartment syndrome and so on and so forth. So due to which we need to remove any of the solid constricting items so that we can prevent further damage. Seek medical help, transport to a facility with antivenom as soon as possible, and clean wound. You need to be very cautious. Gently wash with soap and water to prevent infection. No much rigorous washing to be done there. Gentle wash is enough in such conditions. Now we shall see that one. in which condition these immobilization, also technically we can say that one pressure immobilization bandage can be prescribed and which condition not to be done. So this is the domain of experts wherein the doctor can, based upon the symptoms, he can assess what type of snake it is. A general public, he may, if he is expert or if he was a trained one, he can go ahead with the things, or else it's a domain of doctors. When a venom is neurotoxic in nature, for example, case of cobras, crips, etc., in such conditions, wherein the executive symptoms will be respiratory failure, paralysis, etc., in such conditions, pressure immobilization bandage is recommended. And also, we need to keep monitoring his airway and breathing regularly. When a hemotoxic in nature, only immobilization is prescribed. Why? Because there may be hemotoxic in nature, there may be locally swelling, edema is a feature to be observed there, and if we apply a pressure bandage, it will worsen the condition. Also, when the venom consisting of cytotoxic in nature, generally we can avoid pressure bandage. The techniques to be adopted there. So is split can be taken and then see that the movement is restricted and then the position to be maintained as below heart level and then to be taken to the hospital as early as possible. What not to be done? Do not suck at the bite, do not cut or injure, or no alcohol or acids pouring or no delay. In total, no manipulation is required, just immobilization and then move to the nearest hospital. Now coming to the crucial part regarding doctor's role beyond the hospital walls. He is a community educator. He is a timely medical care and then coordinate health system. Now, as a community educator, you need to frequently conduct awareness camps. Now, when you undergo any survey, etc., or such conditions, there may be the few areas which are endemic. Common incidence of snake bite in that village or area is common. In such conditions, we may conduct awareness camps and also educate regarding the season flu, which is high risky. We educate the common man and then the bite can be prevented. One more persons like ASHA workers, ANMs, panchayat leaders. Why? Because they on day-in-day basis they used to interact with the people. So when we educate them, every possibility that the common man will be well educated and the bite can be prevented. Collaborative work with local schools and farmer clubs so that they can initiate the action soon. So Muralidhar sir has already elaborated discussed regarding the medical care, the administration of ESV. We need to fix the dosage, dilution should be proper, and also look for adverse events so that proper management can be taken there. Recognize envenomation. So based upon the signs and symptoms exhibited by the patient, again the management will vary. So based upon swelling, bleeding, ptosis, or necrosis, even conditions, so we need to address the issues accordingly. Follow protocols. We need to adhere with the WHO and ICMR guidelines properly and train staff. So early referral by a peripheral health staff saves life. Why? Because few conditions may land up in complications like acute kidney failure or the necrotic changes, etc., wherein skin grafting or dialysis, etc., is required. So we need the help of higher centers and trained staff. So accordingly, when to be referred, etc., to be well educated. Doctor's role in a coordinated health system. We need to maintain a referral linkage with higher centers, advocate for ambulance access in remote villages, participate in surveillance and data reporting. Again, regarding there are, as we discussed, it's a collective effort. So institutional preparedness, stock anti-venom serum and splints should be there in primary healthcare centers. Proper storage to be done for anti-venom serum and referral linkages. So establish ties with the higher centers for complex cases. Coming to the important part, like rehabilitation and follow-up. So as we said that one, few conditions will end up in complications. If the tissue necrosis is massive, there is a possibility of amputation, etc. And then there will be a huge psychological trauma in such conditions. So we require proper rehabilitation in such conditions and proper guidance by doctor and the whoever nursing staff is required in such individuals. So community doctors are crucial for long-term recovery. At times, few bite cases, there may be non-healing ulcers. Again, it requires a proper detailing regarding the management. One more aspect regarding the bite cases, always document bite site, signs and time, police intimation if suspicious circumstances. Why? Because at times there may be the possibility of homicide, and then proper information to be given to police in such in conditions of bite cases. Beware of paid bite cases for insurance fraud. To conclude, the doctor should be vigilant, be prepared, be a teacher, ensure timely care. Be vigilant in the sense he need to before the bite happens, he need to create awareness amongst the people regarding the possible seasons they may encounter with the bite and so on and so forth, so that if he is vigilant, he can prevent a lot of bite cases. Be prepared with all the medications required in such bite cases happens. Also, a network should be established, reference centers should be sensitized in such conditions. Be a teacher, again, we need to proper educate, debunk the myths, proper education is required, and then ensure timely care. With this, I stop, and then stating that community preparedness is utmost important for saving the lives. Thank you one and all.
Thank you, sir, for your insightful session. It was truly informative and valuable. If you have any queries, please message through the chat box. Whoever has joined through YouTube can also message in Abhijna group. Sir, there is one query by Bhagyashree Patil. How does snake conservation relate to snake bite awareness?
Please repeat the question. Please repeat the question.
How does snake conservation relate to snakebite awareness?
Yes, exactly. So there are, as we discussed, the majority of the bite happens because of the big four snakes. And then the snakes are the part of ecological system. They strike a balance in the environment in one or the other way. So in the fear of these venomous snakes, when the snakes which are harmless are taken down, then every possibility we are going to imbalance the nature. So, the common man should be well educated regarding these venomous snakes and ward off or conservation to be done in such individuals. So, when we keep educating so that we can preserve the nature as it is and be very cautious regarding these venomous snakes.
Thank you, sir. If there are no more queries, we can move to next session.
Is it audible? Yes, ma'am, you are audible.
रही है उन्होंने आपके कॉल को होल्ड पर रखा है
Namaste and good afternoon to all. I am pleased to introduce our esteemed resource person and our beloved faculty, Dr. Ranjana K. Ma'am. Ma'am has completed her UG from STM College of Ayurveda, Hassan, and MD in Agadatantra Evum Vidhi Vaidyaka from Sri Dharmasthala Manjunatheshwara College of Ayurveda, Hospital and Research Center, Kutpadi, Udupi. She has secured 4th rank in university level MD final year examination in Agadatantra Evam Vidhi Vaidyaka. Presently, Ma'am is working as assistant professor in PG department of Agadatantra Evam Vidhi Vaidyaka in Sri Dharmasthala Manjunatheshwara College of Ayurveda, Hospital and Research Center, Kutpadi since 2023. She is working as aesthetic OPD consultant in the Department of Aesthetic Medicine in STM Ayurveda Hospital, Kutpadi, Udupi. She has worked as consultant for 4 years at Sri Southern Ayurvedic Clinic, Vellora, Kannur, Kerala. She has also worked as clinic in charge and chief physician for 2 years at Sri Ranjanam Ayurvedic Healthcare, Annur. Ma'am has attended and presented many research papers in national and international conferences. I shall request Dr. Ranjana Ma'am to proceed with presentation.
Thank you, Dr. Sonia, for your good introduction. So, is it visible, mice?
Yes, ma'am. Slides are visible and you are audible.
Slides are visible?
Yes, ma'am.
Okay. So, good afternoon, everyone. It's truly a pleasure to be here for the presentation. First of all, I thank the organizers for giving this opportunity. And today, in this section, I'll be discussing the Chaturvimshati Upakramas, which and all applied afterwards, like in Kerala Visha Chikitsa, what and all Chaturvimshati Upakramas, base of Chaturvimshati Upakramas, applied for the further treatment of, or the treatment protocols of the Visha Chikitsa. Okay. So, moving to introduction. So we all know Prayoga Samuchaya, Kriya Kaumadi, Jyotsnika are considered as the field manuals of Visha Chikitsa, and the treatment methods and medicines or the treatment protocols, treatment procedures which are all explained in this Prayoga Samuchaya, Kriya Kaumadi and Vishwavidya Jyotsnika, that and all the replica of Acharya Charaka's Chaturvimshati Vishopakramas. So both Susruta and Vagbhadacharya have mentioned each of the treatment modalities, like the explanation for each of the treatment modalities. Acharya Charaka and Acharya Acharya Vagbhadacharya and Acharya Susruta given each explanation for each modalities. Till the Charakacharya given a group of like 24 Upakrama group. He like Acharya Charaka who grouped them together and presented them as a set of 24 Upakramas. So, in Visha Chikitsa, in Kerala Visha Chikitsa, So Visha Vidya and Visha Vaidya are considered as the Visha Chikitsa. So Visha Vidya includes the Mandropajaras, Mantra, Tantra, Mantra Tantra, which and all using for the Visha Chikitsa. It is included in Visha Vidya, and Visha Vaidya means the medical. So what and all medicines we are using, Aushadha Prayoga, that is considered as Visha Vaidya. So let us recall the Chaturvimshati Upakramas, that is Mandra, Arishta, Utkartana, Nishpidana, Ajushana, Agni Parisheka, Avagaha, Rekta Moshana, Vamana Vire Gopadanani, Vidyavaranam, Anjanam, Nasya, Dhuma Lehaushada Prachamanani, Pradisaranam, Pradivisham, Sanyastapanam, Lepaha, Vrata Sanjeevanam Evacha, Vimshati Rede, Chaduthiratikaha. So last line you can notice, Syurubakramaha yada ye yatra yojyaha shrunu tada tan. So it means yada ye yatra yojyaha. So Charagacharya already mentioned like yada ye yatra yojyaha, where it is indicated or where it is yojya, that the situation you have to, according to the yukti of the physician, you have to decide the treatment protocols, what is explained in these 24 upakramas. So, when you check the basic principles of treatment of snake bite poisoning, so it includes prevention of further exposure to the poison, use of antidotes, removal of the absorbed poison, and symptomatic management. So, our Chaturvimshati upakramas, again, we can consider under these headings, prevention of further exposure to the poison. So first Chaturvimshati Upakrama, that is starting from Mantra, Arishta, Utkartana, Nishpidana and all, it can come under the prevention of further exposure to the poison, because it will stop the spreading of poison and it won't make it further exposure. And use of an antidote. Use of an antidote means Hridyavarana Chikitsa and the Pradivisha Chikitsa. We can consider it. And removal of absorbed poison, Vamana and Virejana procedures, we can consider under this. And last, that is symptomatic management, that is Sanya, Pranasha, Nasya, Anjana, Karma and all, you can consider under this head. So moving to the first and most Chaturvimshati Upakrama, that is Mantra. So as we all know, Charagacharya Chikitsa Vidhi, 3 types of Chikitsa Vidhi explained. In that, first one is Daiva Vipasraya Chikitsa. So he explained it first because it is having Ashukarikva, it's having an immediate action. So because of that, he explained it in first. And the Sarpavisha practice, which is there in, which were practiced in Kerala, it's like almost all practice the Mantra Chikitsa. And I'll quote one story, or I quote one case here, what I read from the Avanaparam Mahesha Nambudiripat Kerala Visha Chikitsa book. So in that, it's like 60 years back, like 70 years back, one person who taken to the cremation ground and presumed dead despite all medicine's effort, his condition showed no improvement, because after taking medicine also he didn't show any improvement, and he was taken to the cremate. And famous expert in poisonous treatment, that is Trikkovil Kunyikrishna Warrior, requested permission to examine the man and saying he would like to try once. So though the power of mantra prayoga, patient was revived and brought back to life. So you can understand, like you can think like before 70 years also, the practice of mantra was present in Kerala, and till now I think some of the Visha Vaidyas are practicing mantra, because in Kuthuparampu also, Kannur Kuthuparampu also, one Nanu Vaidya is there. So he is also practicing with the mantra chikitsa. And recalling the serpent to bite again and take back the Visha. So using the mantra chikitsa, they used to recall the serpent and bite the same bite side and take back the Visha. And the mantra chikitsa, we all know, it will help for the activation of parasympathetic activity and lowers the sympathetic activity. So in snake bite case, in WHO category also, it is first line of treatment is reassurance to the patient. So reassurance means you have to give a confidence to the patient, because if the anxiety increases, again there will be a more blood circulation and it will cause the damage to the, or it will cause threatening to the life of the person. So mantra chikitsa will give many effect in this condition. And Neelakandya Tyakshari mantra and Garuda mantra, Trayakshari mantra, Mrityunjayakshari mantra, these and all some of the mantra yogas which is practiced in Kerala. So next moving to the Arishta Bandhana. So I am not going in detail with each the Upakramas. So Arishta Bandhana we all know it should be, that tonic should be applied 4 inches above the bite side, and it will help for the restriction of, it should not restrict the lymphatic flow and it should restrict the blood flow, and it will slow down the further spread of the Visha. So Ambuvat Sedu Bandena, Ashtanga, in Ashtanga Hridaya, the reference is like Ambuvat Sedu Bandena. We all know dam how it will block the water. So when it will block, it won't block complete water. It will just slow down the water and it will move. It will help to move the water in a slow motion. So same way you have to do the tourniquet, and when you are doing the Arishta Bandhana, it should be in a proper way. So you have to follow the auricular, that is Arka Patra Sweda, which is explained in traditional books. So before removing the tourniquet, you have to start the Arka Patra Sweda, and Arka Patra Sweda means you have to take 10 to 15 leaves of Arka, and one by one you have to keep it and tie it in the middle part at the tip of the part, and just in a pan you can make boil the Gruda and Saindava, and in that you can dip the kiri, and you can do the kiri in downward portion, okay, downward movement. So this one you can start, and then after, when the patient tells the pain and the burning sensation, whatever he is having, that particular local area symptoms, when it comes to near the Kadivaya, that is the bite site, that time you can stop the Arka Patra Sweda and you can remove the tourniquet. So if you are following that proper way of Arishta Bandhana, it won't cause any effect. As you all know, WHO is not recommending the Arishta Bandhana tourniquet bandage, but if you are following it in a proper way, in morning session, Muralidhar sir also mentioned these things. So if you are properly following these things, it won't make any complications. So next, Utkartana, Nishpidana and Rektamoshana. We all know the purpose of these all are same, like bloodletting. So in 3 methods it is doing, but the purpose is same, bloodletting. And in books, the reference is like maximum 1 nari, that is 250 ml of blood you can let from the body. And the regions it is mentioned like Sandhi near to Damsha Pradesha, Kaksha, Uru and Jana Pradesha, and with properly clean glass piece 1 or 2 inches above the bite side. So in this Rektamoshana and all, it is explained in Charaka Samhita, but afterwards in Kerala Visha Chikitsa, it continued like, if you are getting a glass piece, clean glass piece, you can give an incision and you can go for the Rektamoshana or Utkartana like treatment. And one more reference, one more practice I heard, like if you are getting a bangle piece also, glass bangle piece also, you can go with the Utkartana in the emergency condition, because in snake bite usually it will come in emergency condition. So Ajoshana procedure, as we all know, Ajoshana is just sucking out the blood from the bite side. So in classics it is explained like Mrit Basma Agada Gomehi. You have to coat the mouth with the Mrit Basma Agada and all, and then the person should suck the blood from that particular area. And afterwards in Kerala it is practiced like Vishakallu Prayoga. So Vishakallu, it is having same effect, like work as a synthetic magnet that attracts toxin in blood when placed at the bite site. So what you will do is, the Vishakallu, you will just attach the bite site, and when it sucks the blood, so it will absorb the blood, and when it is complete, means when it is full, it will just fall down itself. the Vishakal, it will fall down itself. And if you want further, you can attach the second Vishakal. Means you can identify like by considering the signs and symptoms, you can assess the requirement of Vishakal for next further treatment. So next is Agni Karma. Agni Karma with the Sorna Loha was practiced, and immediately after bite. So these all Upakramas, immediately after bite, if you are following these all Upakramas, it will give good results. Or afterwards, if you are doing, it won't give much results. And in books, it is having the reference is like within 1.5 minutes. Within 1.5 minutes, you have to do the Arishta Bandhana. That is 100 Matra Kala. The Visha will stay in the particular Damsha Pradesha. So you have to do it in 1.5 minutes, the Arishta Bandhana. Then you have to go for the Kiri, that is Arkapatra Sweda. Then afterwards, when the signs and symptoms in the local area, it will come down. That time you can remove the Kiri and you can go for the Dara, Leva like procedures. So here in Agni Karma, so if it is needed in any particular condition, you can go with Agni Karma. So in olden days or in Kerala, this practice with Sorna and Loha. Immediately after you have bite, you have to go for this procedure. And it is mainly contraindicated in Mandali Visha. So Mandali Visha, we all know Pitta Pradhana. So in this condition, already the bite site will be having Pitta Pradhana Lakshanas. So if you are going for the Agni Karma procedure in that particular condition, it will again increase the signs and symptoms and it will cause more Upadrava to the patient. So in books, there is a reference like how you have to detect the Mandali Visha. So in a Kamsya Patra, when you are placing near the bite site, the person we can feel intense heat as soon as when you are removing that vessel. So in Mandali Visha, when you are just keeping near to that bite site, that time itself the person will feel the intense heat because of that Mandali Visha. So next procedure is Parisheka. So Parisheka, when Visha is in Togdadu and it is having a Stampana action, severe pain and pricking type of pain, Grida Baldwai adding Saindava Churna and Dara you can give in lukewarm form if the patient is having severe pain and pricking type of pain. And Shuddha Jala with Chandana, Shidobajara, as Shidobajara, Shuddha Jala with Chandana for Mandali Visha, you can go for Dara. And Shuddha Jala, it is specifically mentioned like well water. So when you are, nowadays we can't expect that pureness in the well water. But in olden days, what they are collecting from that well water, it is pure. Okay, so with that well water, they used to do the Dara. And cow's milk added with Nalpamara Kashaya Dhara for Brana Shuddhi and reduces the burning sensation. So in this consideration, in olden days, like in Kerala, there were two practices like Tukudara and Jaladara. So Jaladara is like Shidala Jala Dhara, helps in constriction of blood vessels and arrest the virulent spread of the Visha, help to flush out the venom present in the wound, and well water for Jaladhara, duration 1.5 hours continuously, not suitable for Darvigar and Dajila Visha. So here it's like you are pouring continuously the Shuddha Jala, that is well water, to the particular part where the bitten part, and it should be continued up to 1.5 hours. So considering the signs and symptoms, you have to stop the particular treatment. And here it will give a Stampana effect, and this also according to WHO, it is not recommended, because when you are giving more pressure and you are washing that area, it will increase the spread of the Visha. So when you are, first only I mentioned like when you have the tourniquet like Arishta Bandhana done, that time you have to go for this Jaladhara, Arkapatra Sweda and all. Because after doing this, when the Ubadravas or the signs and symptoms will come down, that time you can go with the other treatment modalities. So these and all like first line treatment for the Sarpa Visha. And Tukudara helps to reduce the swelling, And this is like in this picture you can see the pot like this. In olden days these kind of pots were there, not there. So in a pot the down part it should contain one hole, and you will fill the medicines in that pot, and continuously with hand you have to pour the medicines in that particular bitten part. So the medicines used for this Tokudara are Nimba, Vrikshadani, Chandana, Shadavari, Kumari Surasa, Kushmandalata and Erandapatra, and all the ingredients grind in equal quantity, and then with pure water you have to mix it, and you have to take in that patra or vessel, and you have to go for the Dara procedure, and it will help for reducing the swelling. And one more reference I got, like in Tokudara, the Ishwari having the name like Urituki. So because of that, by using Urituki Kashaya or Urituki preparation, if you are going for the Dara, it is also considered as Tokudara. So next, Vamana procedure. So Vamana procedure, as we all know, it is usually using for the Kapha Pradhana Vikaras. And Vellod Prayogam means what means is bronze. Okay, so the Ikshwagu boiled in Kamsya Patra along with the Ajashira and given to the patient. So in Kamsya Patra you are just boiling the Ikshwagu, and along with the Ajashira you are boiling and you are providing to the patient, and because of taking that one the patient will start vomiting. So in Mahamandali Visha it is usually doing, and the reference is from Prayoga Samuchaya, and these were also practiced in the olden days. And one more reference I got from Sampurna Vishavaidya, like Angola Bija, Nimba Bija, Arka Bija and Datura Bija, each equal part, you have to grind it in hot water and you have to provide for the patient, and by taking this it will induce the vomiting, and because of that the Vikaras will come down. So next is Virejana. Virejana, as we all know, in Pitta condition usually we will go for Virejana, and Visha when it is in Pakvasha. So Visha when it is in Amasha we will go for the Vamana Chikitsa, and in Sarpa Visha condition we won't get much, so we won't recommend the Vamana Chikitsa more, because usually in Stavari Visha condition it will give good result than a Jangama Visha condition. And Virejana Visha, if it is in Pakvashaya, mainly for Mandala Visha with all Lakshanas, because in all almost all Chikitsa Rubas aspirant for were practiced in Kerala was for Mandali Visha, because in southern area and in Kerala areas almost all there will be more viper bites cases. So almost all were practiced in that Kerala region was for Mandali Visha. And Virejana condition, morning Manjishta, Lodra and Arka Kashaya prepared, and with Avipati Churna you can administer for Virejana purpose. And evening same Kashaya with the Vilvadi Guliga or Taruna Bhaskara Guliga or Visha Vilvadi Guliga you can provide for Virejana purpose. So these all reference I took from Avanaparambu Maheshwara Nambudiri book, like Kerala Visha Chikitsa, one book he written with his experiences, practical experience. So next, Anjana and Nasya Karma. So here Bilvadi Gudiga as Anjana if you are using, it should be mixed with the Tambula Surasa, and Nasya if you are using Drona Pushpi Surasa, and Trikadu Hingu grind with Drona Pushpi Surasa for Nasya purpose in unconscious patient. So this can be taken as Sanya Pranasha also. And Purana Marija with the Tambula Surasa or Jala Anjana in unconscious state. So more references are there and this Anjana and Nasya, till now I think practicing the Anjana Nasya for Visha Chikitsa. So next is Dhumapana. Dhumapana, crushed tila, barhi kukuda pincha. That is feather of cock and peacock and mixed with Saindava, and in this add Hingu Churna and Daru Haritra. Without Hingu Churna and Daru Haritra also you can go for the Dhupana Karma, or with Hingu Churna and Daru Haritra you can go for Dhupana Karma. And in Kerala which were practiced like with Hingu Churna and Only Hinguchurna and Daruharidra you can give Dopana for the snake bite case. Snowy and human hair, Daruharidra mixed with husk and burned by putting in the coal. So that also you can take as Dopana, and it is specifically mentioned like only after 5:30 in the evening or before 9:30 in the morning. So middle part we all know Pitta Prakopa will be there. So before these times you can go for the Domana Karma. And specific method also mentioned in that book. It's like if you are giving Dupana Karma for the full body, Gridha Saindava application sleep in a coir cot. That is after applying the Gridha and Saindava mix on the body, full body, avoiding the upper neck part. So make the patient to sleep in a coir cot and apply Gridha in the vertex of the head. So in Murthy Pradesh also you have to apply the Gridha and cover full body with a blanket, avoiding the parts above the neck. So cover the patient fully and place embers in a pot and add the medicine powder with ghee in a bolus form to the pot. So you can make a bolus form with the medicine added with ghee and you can put in that embers and keep the pot below the pot, and for 5 minutes duration, for 5 minutes you have to go for the full body Dupana. So it is, if it is inhaled, the Duma which is coming from that particular, if it is inhaled, it is not good for the patient. If it is inhaling for a long duration, it is not good for the patient. So the duration is less in this particular. And next, Lehya Prayoga, how it is utilized, like Vishahari Lehya. It is for diagnosis of snake bite cases. So Vishahari Lehya, when the patient comes, the Vishahari Lehya, it will apply in the betel leaf and provide, give to the patient. Then when he chew that one, what taste he will get. According to that, the person, the physician or the Vaidya will diagnose the particular condition. So if he assumes the Kadurasa, then it is Darvigara Sarpa. If it is Amla Rasa, then it is Mandala Sarpa. If it is Madhura Rasa, it is Rajila Sarpa. And if the patient is having Kashaya Rasa, then we can assume like it is having slight envenomation. The person is having slight envenomation. So Aushadha Prayoga, as we all know, and this is practiced now also, like Jeevaraksha Gudika, Mrata Sanjeevani Gudika, Vijvadi Gudika, Vishwavivadi Gudika, Hingvadi Gudika, etc. Shamana Chikitsa, like after doing the procedures, after doing the Shodhana procedure or after doing any procedure, if some amount of Visha is remaining in your body, so you have to remove it by the Shamana Chikitsa. You have to provide Shamana Chikitsa for the particular patient. So in reference, no specific Shamana Chikitsa is explained, like Shamana Chikitsa, like administration of Patti and all is explained. And in book Avanaparama Maheshwara Namboodir's third book, I got two references like Kanji preparation and Snana Vidhi. So Kanji preparation, here Neeli Moola 10 grams, Punarnava Moola 10 grams, Shundi 10 grams and Kandiliyeva Moola 10 grams, crushed and tied in a cloth and boiled and prepared gruel using the broken rice. So you have to tie it in a cloth and you have to keep it in a boiling gruel. Okay, boiling. So you have to boil the broken rice in a vessel and you have to keep this tied cloth in that particular vessel and you have to make the gruel. Added Bilvadi Gudika along with the rice water. If you are providing the rice water to the patient, you have to add Bilvadi Gudika along with that one, and 2 to 3 days medicated Ganji to be administered. And Snana Vidhi should be done in the evening time, and Kulichi Pachotyadi Taila for head. So for applying for head, you can use Kulichi Pachotyadi Taila, and it was used. And Marija Durva crushed and boiled in coconut oil applied in Murthy Pradesh. So if it is available at a sudden, if you are not having Kulichi Pachotyadi or any other kinds, and it is mentioned like if you have any other option, you can use that oil also, but usually Kulichi Pachotyadi Taila is using for the head massage. And Marija Durva you can crush it and you can boil it in the coconut oil and you can apply in the Mukha Pradesha for bathing. And with lukewarm water or the water which is kept in the sunlight and it is boiled. So that water also you can use for the bathing purpose. After snana, massage the murti pradesha with the Rasnadi Churna or Kachuradi Churna. And Lepana Chikitsa. So these and all Lepana Shikripunanavadi Lepana, which I took from Papanasheri Visha Chikitsa Kendra, photo took from Papanasheri Visha Chikitsa Kendra, and apply Lepana after stopping the kiri. So immediately after stopping the kiri. So when the local signs and symptoms come down, so that time you can start with the Lepana Karma. Arkapatra and Hingu grind well and apply repeatedly. Ashwagandha plus Vaja, Sarvanga Lepana. Eranda Bija Mula and Nili Bija and Nili Bija and Mula. Grind it in Tandulambu and you can go for the Lepana Karma. Chikrupana. So I just included the medicines which are available easily, and furthermore Lepana procedures are explained in the Kerala Visha Chikitsa book. And Shigripunanavadi Lepa, it is using for the Mandali Visha swelling condition. If the edematous condition is there, local edematous condition is there, then you can go with the Shigripunanavadi Lepa. And Sanyastabana Vidhi, Karuprayoga was practiced in Kerala to overcome the death in unconscious patient or suspended animation. Karu is a tubular instrument shaped like the Datura flower. So it's not Karu. Just for your understanding, I kept this picture. So it's like this shape it should be. And in male, 6 angular length and female 8 angular length, you have to take the Karu. And filling Karu with medicines and liquid like rasa, that's parada melted by heating, blown into the Gudamarga or Mutramarga or Nasa or Karnamarga, etc. So you have to fill the Karu with the parada and other medicines, and you just melt it and you have to blow it in the Gudamarga or Mutramarga or Nasamarga, Karnamarga. And boiling liquid directly transferring to the mucous membrane. So when it is directly transferring, if the patient is unconscious, he'll get the consciousness. So Utu Chikitsa is also a unique concept explained in the Kerala Visha Chikitsa, but it is mentioned mainly in Tok Rekta Mamsagata Visha. So when it is the Visha is staying in Tok Dadu, Rekta Dadu or Mamsa Dadu, we have to go for Utu Chikitsa. But it can take it as a Sanya Pranasha also. And Vishwa, Dusparsha and Marija, these 3 drugs one should chew in the mouth, and 3 people should be there for the Utu Chikitsa, and they should chew these drugs in the mouth, and they have to blow like in both ears and scalp. One should stay 2 people should stay near to both ears, and one should blow from the upper part. 150 times you have to blow. So these are some examples of cases like I took from the Avanaprama Maheshwara Nambudiri Padu when I went for posting. So in this case sheet you can see the date of the case like 2004. So it was practice. So all the procedures what I explained here, it was practice, and till now also some Visha Vaidyas are practicing the same, like Manamadam Vaidya and all. He is practicing Jivarasha Gudiga Mrityunjaya Rasa and other Karuna Bhaskara Churna. So these all they are practicing now also. And in this observation you can see with the Lehya, Vishahari Lehya, he identified the snake, that is viper, sore taste, sore of changes. So he identified the case and he went for the Indupu Grida Chandana Thara. So Dhara procedures. And in this also you can see he gave the Dhara procedure and Ramaja Chandana Lepa. And in this case sheet you can see it is Utu Chikitsa. So Utu Chikitsa, like as I told, blowing on head and 2 ears. So I am concluding this section with Visha Vaidyas successfully treated even highly poisonous snake bite by using unique treatment modalities. the introduction of antivenom and the unavailability of good quality drugs are the major reasons for the decline of traditional management. Further studies and experimentation are needed to provide scientific proof for our ancient treatment modalities. Thank you.
Thank you, ma'am, for guiding us through the timeless teachings and interpretations of Acharya Charaka. If you have any queries, please message through chat box. Those who have joined through YouTube, you can also message in the Abhijna group. Ma'am, we have one question from Prerana R. Ade.
Okay.
Does Sadhya Asadhyata play any role in snakebite management?
Yes, actually, okay. Please proceed.
Ma'am, question goes like, does Sadhya Asadhyata play any role in snake bite management?
So Sadhya and Asadhyata also, actually in this book, I read this book, and in this book it is explained like, you have to do, in Chaturvinshati Upakrama, you know, Upadana Chikitsa is mentioned, Kakapata Chikitsa is mentioned. So Kakapata Chikitsa, you have to go for Kakapata Chikitsa, and you have to find out the person is Mrita or he is having life. So that particular is like, you have to give incision in the vertex region, and you have to pour the melted parada rasa in that vertex region, and you have to keep the patra, that is vessel, which contain the coconut shell, these parts, burned part. Okay, so when you keep that in the vertex region, so it will melt, and if it is seen in the if the patient is alive, so if the patient is having life, the person will be conscious suddenly because of the entry of that parada. It will just, when you keep the vessel with that coconut shell burned, so it will just melt the parada, and it will reach to the body of the it will reach to the brain through the vertex, and it will cause consciousness in the patient. So you can identify in that way, and some other methods also are explained in the Kerala Visha Chikitsa for identification of the particular thing. And after identifying, like if the patient is whether the patient is having life or not, after identifying this, you have to go for the further treatment. Otherwise, and in that one more coating is there, like if you know, if you have the confidence, like you can treat that patient, and you can but manage the condition, then only you have to go for the further treatment. Otherwise, you have to tell the patient like you have to consult, or you have to go with the other Visha Vaidyas.
Ma'am, you have another one question. Question goes like, can we correlate these management and treatments with contemporary or allopathy medicine?
Okay. So when you are correlating these treatment modalities, as I told, Mantra Chikitsa you can correlate with the sound therapy or musical therapy what is practicing now. So it is not for Visha Chikitsa, but still the same concept, or the usually the syllables or the pronunciation what is there in the Mantra Chikitsa, it is helping for the, it is also having a role in the result of that particular treatment. So when we are doing the music therapy or sound therapy, it's the same, the music waves or the sound waves or the resonance or the syllables what is coming there, it will help for the particular condition. So not in, I didn't get any reference like for Visha condition, but musical therapy and sound therapy we can correlate with the mantra chikitsa. And again, tourniquet anyway WHO it is not recommending Arishtabandhana and all, but tying tourniquet it's like a bandage they are doing. So they are just bandaging that part and immobilizing the part. It is we can consider the advanced part of that one. Like in a particular area they are not tying that particular tourniquet, but bandaging that part we can consider it as a what further like advanced part of this. And other MSCs and all what we are following for activated charcoal, it is for the absorption of the Visha, activated charcoal what we are using. And again, demulsions what is explained in management of poisoning, we can consider the Grida Prayoga or Chira, almost all Visha conditions we are using the Grida. Charaka, Acharya Charaka mentioned in Charaka Samhita, Chikitsa Sthana. So, as we all know, Agadatantra concept mainly Acharya Charaka given one full chapter, like 23rd chapter for Visha Chikitsa, and Susracharya mentioned 8 chapters, Kalpasthana completely for Visha Chikitsa, and Ashtanga Gara also 8 chapters for Visha Chikitsa. So, here all the acharyas like Susracharya and Ashtangagara, like Vagbhatacharya also mentioned the Chaturvimshati Upakramas in detail, but they didn't group it as a 24 Upakramas, but they are giving the complete explanation of each Upakrama, and it is related to Agadatantra only. Like it will give good input in Agadatantra because all the, as I told, it can be correlated with the modern concept of modern management of treatment also. It is an advanced form of Chaturvimshati Upakrama only. So what and all we are doing in snake bite condition, WHO management at reassurance. First we have to do the reassurance to the person, and then anti-snake venom we can consider it as a Prativisha concept only. Prativisha anti-snake venom, like that we can relate it the Chaturvimshati Upakrama which and all told in Charaka Samhita in the Agadatantra.
Ma'am, further no more question. Thank you, ma'am. Thank you for the enlightful session.
Thank you so much.
Now, we are sharing a small information regarding recently published textbook of Agadatantra, as we bear a cordial relation with the author Dr. Vishnu Prabhakar Jonglekar, who was also the previous resource person for our Trisha International Seminar 2022. Here is a book titled Comprehensive Textbook of Agadatantra Evum Vidhi Vaidyaka, Illustrated Toxicology, Forensic Medicine and Medical Jurisprudence. Salient features of the book are that it is assigned with NCISM syllabus 2023 for BAMS covering all core and newly introduced topics, and it follows a holistic approach to promote deeper conceptual clarity, and it is fully updated with BNS, BNSS and BSA ensuring legal relevance, and it is acting as a practical guide for practitioners and medical officers to stay law compliant, and it integrates latest protocols, research findings, and clinical insights. It is enriched with references from classical samhitas, strengthening Ayurvedic foundations, showcases wisdom from traditional Visha paramparas, adding cultural depth. It implements NCISM endorsed teaching learning methods for effective pedagogy, and it includes chapter-wise MCQs for self-assessment and quick revision. And it helps in visualizing captivating with high-quality graphics. And it is based on new NCISM syllabus for BAMS second profession as per the competency-based Ayurveda medical curriculum. Now, we move on to the most awaited segment, that is Best E-Poster Presentation. The E-Poster Presentation session The e-poster presentation session will be held in one more link. Please do log in through that link, which is put up in the WhatsApp group. Thank you.
ಈಗ ಕೊಡಿ ಹಾಂ ಮಾಡಿ ಕೊಡಿ
Now we move on to the most awaited segment, that is the best e-poster presentation. The e-poster presentation session was held on 15 July 2025, and after expert evaluation, best 6 e-posters were awarded. In faculty section, first prize was bagged by Dr. Vishal and second prize by Dr. Seetal. In PG section, first prize by Dr. Jitesh, second prize by Dr. Reshma, and in UG section, first prize by Ritika, second prize by Sindhu. Congratulations to you all. Now, the best e-posters will be presented by the respective presenters one by one, and we will be sharing the screen. The presenter presenting, please keep the mic and video on. On first presenter, Dr. Vishal.
Am I audible?
Yes, sir, you are audible.
Can I start?
Yes, sir, please start.
Okay. Good afternoon, all respected faculty members and delegates. I, Dr. Vishal S. Kumar, Associate Professor, Department of PG Studies in Kaumarakritya, JSS Ayurveda Medical College, Mysuru, and PhD Scholar, SDM College of Ayurveda, Hassan, presenting on the topic Ethnomedical Insights and Novel Antivenoms for Snakebite Envenoming, Advances, Opportunities, and Challenges, under the guidance of Dr. Shailaja U, Principal, SDMC, Hassan. Snakebite envenomation is a major public health issue, especially in the tropical countries like India, significantly contributing to the mortality and morbidity. Snake venom toxins can be classified into 63 distinct families, and among those 4 families are significant, which I have displayed here. 3-finger toxins, phospholipases A2, snake venom metalloproteinases, snake venom serine proteinases. Traditional polyvalent antivenom is the available treatment of choice, and the limitations are displayed here. That is local tissue damage. Next is adverse reactions, which we can again classify into 2. That is early adverse reactions, which will happen within 24 hours of antivenom administration, and late adverse reactions, which will happen within 5 to 24 days after taking antivenom. So in severe cases, antivenom can trigger anaphylactic shock, which can potentially lead to death. So other limitations include high cost of manufacturing, limited efficacy in terms of specificity, then time sensitive, that is we have to administer the antivenom in certain specific time itself, and inadequate availability, especially in the rural areas. So below I have given some of the herbal drugs which we are widely using. The compilation of drugs which I have depicted here show the phytochemically and experimentally studied drugs in the management of snakebite management. So these include Gunja, Shirisha, Punimba, Ishwari, Lankali, etc. Now let's see the mechanism of action of these botanical drugs in snakebite management. So first one is enzyme inhibition. So most of the drugs are phytochemically proven to be acting against the PLA2, which is one of the snake venom toxin. Then certain compounds in plants can chelate the metal ions like zinc, which is required for snake venom, especially serine metalloprotease, which is present in the common crate. So they require the ion zinc to act as a venom. So certain compounds in the herbs will neutralize it by chelating with that. Then physical interaction. So this will obstruct the venom ability to bind to the human receptors, and antioxidant to counter the measure of oxidative stress, or in scavenging the free radicals, which is causing as a result of oxidative stress. So we can say the example like Sarpagandha, Nimba, etc. as an antioxidant, and anti-inflammatory example we can say the root extracts of Nirgundi, Amalaki, etc. So what are the challenges we can face in this is mainly the scientific research and standardization of the plant extracts. So in this area, we have to work little more so that we can come to a standardized medicines for the snake bite venom. Now we coming to the invention or the concept of novel recombinant antivenom. So we know that antivenoms has been saving the lives for more than 125 years. But when compared to other diseases or other areas, which were very much progress due to the advancement of biotechnology or omics technology, the progress made in the current antivenom or snakebite management is not so satisfactory. So there lies the importance in innovation of a novel recombinant antivenoms. So here I have included some of the preliminary research works, which is in the subclinical stages maybe. I have included very few. So first one is genome-independent immunization techniques. So these are gene-based method without the use of actual snake venom. So there is no need of capturing the snake or reptile for procuring the venom. Then next one is nanotechnology enhanced anti-venom delivery. So for enhanced stability, target delivery, controlled release, etc. So here the newer technologies like encapsulation will be used. Techniques like encapsulation is being used here. Next is pluribody technology or CRI. So here genetically engineered plants for diverse antibodies which are similar to hyperimmunized mammals like camels or horses, which we are used to procure the antibody against the antivenom. And another one is very important, that is recombinant antitoxin monoclonal antibodies, MABS. So here individualized immunoglobulins through cloning methods, which is considered as a next generation antivenom, is under the study or is under the review of further research, which will help in the faster diffusion, improved tissue distribution, and less complications. So in the table given below, I have given the differences of traditional antivenom and recombinant antivenom, where the target-specific antivenom, no usage of animals or very rare usage of animals and more cost-effective and less or no complications can be attributed to the newly proposed novel recombinant antivenom. But here, there is no clinical trial data is yet available. That is one drawback. Then, what are the future implications of this? So mainly interdisciplinary research incorporating the modern technology like nanotechnology, biotechnology, DNA recombinant technology, and the ethnomedical herbs can be imbibed. Then standardization is very much important. Standardization and more clinical trials and global collaboration. Snakebite envenomation is a global pandemic. Global collaborations and funding is required in this. Therefore, to conclude, to invent, standardize newer antivenoms, extensive clinical trials and research is required. So I thank you, the organizers of Abhijna 2025, for providing me with this great opportunity to present. And being a proud alumni of SDM College of Ayurveda, it is a very cherishable opportunity for me. Thank you, organizers.
Thank you, Dr. Vishal. It was a really enlightening presentation. Now I would like to call upon the second presenter, Dr. Seetal.
Namaste all, am I audible?
Oh yes ma'am, you are audible.
Can you share my slide?
Visible ma'am? Is the slide visible
Yes,
ma'am?
yes. I am Dr. Sheetal Raj, Associate Professor and PhD Scholar from Enepoya Ayurveda Medical College and Hospital, presenting before you an insight into indigenous snakebite management in Kerala. Kerala had a geographical condition which was favorable for various types of poisonous and non-poisonous snakes, and this might have led to the evolution of traditional treatment techniques of Visha Chikitsa in Kerala. Some of the very ancient treatises of Visha Chikitsa, like Prayoga Samuchayam, Visha Vaidya Jyotsnika, and the Kriya Kaumudi, points out some special treatment techniques of Visha, like Karu Prayogam, Vellotu Prayogam, Vela Prayogam, Vishakallu Prayogam, Jaladhara, Tukudhara, Utu Chikitsa, etc. The treatment techniques were very effective against snake envenomation over a period of time, and this period should be considered as a prime time of Visha Chikitsa, as there were many effective techniques to treat poison. Moving on to Karuprayoga. Karuprayoga is a procedure that was commonly practiced while treating different types of Visha. It comes under Kalavanchana, or to overcome death, which is used in an unconscious patient or when the patient is in suspended animation. Karu is a tubular instrument shaped like a datura flower used to blow medicines into the body. Karuprayoga is the last treatment in Visha Chikitsa and is applied when all the treatment of envenomation fails. And in Karuprayoga, different routes of drug delivery methods were mentioned like the rectal route, urethral route, nasal route, and through the ears. Velaprayoga is explained in Kalavanjanam of Prayoga Samuchaya. Kerala Vishagranthas has given much importance to the plant Gynandropsis gynandra. The yogas mentioned for Lehya, Grida, Thaila, and Gulika should include one part of Vela. Mode of administration is a Pana, Nasya, Anjana, external application in case of bleeding from hair follicles, etc. Vellotu Prayogam is mentioned in Prayoga Samuchaya and is indicated in Mahamandali Visha. And Ikshwagu is boiled in a bronze vessel along with the goat's milk, and this is given to the patients. An indication is headache, anorexia, increased Vata dosha, and Visha located at Amasya. And this yoga induces Vamana and is indicated in all other envenomation cases. And here the mode of action is that the yoga prepared in this way can induce Vamana, which can eliminate the poison which are present in the body. Vishakallu Prayogam, this is explained in Kriya Kaumudi. Vishakallu is a medicated stone, and mode of action is that this medicated stone is applied to the bitten part, and it works as a synthetic magnet that attracts toxins in blood when placed at the bite site. After the procedure, used stones are kept in caution for half an hour and dried to make them ready for reuse. Tukudhara, Jaladhara, when done in a specialized pot called Tukubatra, is considered as Tukudhara. And another opinion about Tukudhara is that the drug used for Dhara is Urduki, that is Ishari Mula, and hence the name is given as Tukudhara. And swaras of leaves of the plants can be used instead of Jala in Tukudhara. And indication is that in case of poisoning, swelling with the pain and local rise of temperature, in case of extreme swelling, Tukudhara is indicated. And it helps to reduce the complication of a bite, especially stony heart edema and vesicobullous lesion formation. Jaladhara is mentioned in Visha Vaidya Josina. Jaladhara is done immediately after snake bite when Visha is separated from of Dabu. Mode of action of a Tukudhara and Jaladhara is that Shitaladhara helps in the coagulation of blood and arrests the virulent spread of poison. Jaladhara and Tukudhara can do Samban action as well. So it will arrest the further spread of Visha from bite to other sites. Utha Chikitsa, this is mentioned in Prayoga Samuchaya and Kriya Kaumudi. Utha Chikitsa is a procedure of blowing medicated air into both ears and in Mutha by 3 persons at a time up to 150 times. The act of blowing is called Utha, hence it is called Utha Chikitsa. Visha residing in first 3 dhatus, that is Tvak, Recta and Mams, are eliminated by this treatment. And mode of action of Utha Chikitsa is that Utha Chikitsa blowing therapy, which is considered as the easiest among all procedure and are used for immediate stabilization of the patient. The effect of drugs are reaching the brain through Shinkataka Marma, which is classically described as situated within the confines of Shiras, nourishing the Grana, Shrotra, Akshi, and Jihva. Cavernous sinus seems to have vascular connection directly or indirectly with these sense organs, and cavernous sinus is an important pathway to brain. It is proven that the active ingredients of drugs which are mentioned in Utha Chikitsa can pass blood-brain barrier, and it also have antidepressant activity. Moving on to the last drop, these unique treatment procedures were used by Kerala Visha Vaidyas to successfully treat even highly poisonous snake bites. The decline in Visha Vaidya was due to some misconceptions that Vaidyas are not allowed to accept remuneration from the patients and the belief that Vaidya and his family will suffer from the effect of curse from snake if they treat the case of snake bite. The introduction of anti-snake venom and the non-availability of good quality drugs are other major reasons for the decline of traditional treatment techniques of Visha Chikitsa. Further research on this will definitely open up a new door to the invention of a novel treatment protocol in Visha Chikitsa. I extend my heartfelt gratitude to the organizing committee and the judging panel of Abhijna 2025. Thank you all.
Thank you, ma'am. Now I would like to call the third presenter, that is from the PG section, Dr. Jitesh.
Can I start now? Am I audible, ma'am?
Yes, you are audible. Is the screen visible
No. The
now?
Yeah.
You may start.
Namaste, everyone. I'm Dr. Jitesh T. Pujari from Alvas Ayurveda Medical College, and today I'm honored to present this poster on the importance of identification of venomous and non-venomous snakes in the observance of World Snake Day. Snakes play an essential role in maintaining ecological balance, yet they are one of the most misunderstood creatures. In India, snake bites cause thousands of deaths annually, many of which are preventable with proper awareness and timely action. This is why being able to distinguish between venomous and non-venomous snakes is not just useful, it can also be life-saving. On the left side of this poster, I have mentioned about venomous species like Naja cobra and the saw-scaled vipers, which are part of the notorious Big Four responsible for venomous bites in India. Now, recognizing features like the hood of the cobra, or the triangular head, or the keel scales of vipers helps us to act quickly in medical emergencies. On the right side, we have common non-venomous species like Indian rat snake and green vine snake. Despite their size or speed, these snakes are harmless and in fact are beneficial. They help control rodent populations and maintain the food chain. Now, the central panel highlights why this distinction matters. Firstly, the misidentification of the species can lead to delayed or incorrect treatment, which can be fatal in venomous bites or unnecessarily alarming in harmless cases. Secondly, it helps us to respond appropriately, be it administering the first aid or rushing to a
Pune in
hospital or simply letting the snake go
Pune,
undisturbed.
Pune,
And
Maharashtra.
third,
Faculty.
identification supports conservation.
Faculty PG
Not
ಸ
all
ಒಂದು
snakes
ಇಂದ
are
ಎರಡು
dangerous.
PG
All killing
ಪುಣೆಯಿಂದ
them
ಪುಣೆ ಅದೇ
indiscriminately
ಕಿಲಕ್ಕಿಂದ
harms our
ಇತ್ತು ಕಿಲಕ್
biodiversity and ecosystem. As an Ayurveda practitioner and health professional, it is our duty to bridge the knowledge between the traditional knowledge with scientific awareness. The text of Agadatantra, which acknowledges the role of snake bite
ಯು ಜಿ
treatment
ಸಲ್ಲಿ
today,
ಬೇರೆ ನಾನು
must be
ಜಾಸ್ತಿ
combined with the
ಮಾತಾಡ್ತಿದ್ದಾರೆ
modern identification,
ವಿದ್ಯಾವತಿ
first aid, and
ಕಾಲೇಜಿಂದ
referral
ದತ್ಕೊಳಕ್ಕೆ
protocol to
ಕರೆಕ್ಟ್
save
ಇದೆ
lives.
ಅಂತಿಲ್ಲ ಆ
So I would
ಕಾಲೇಜಿಂದ
like to
ತುಂಬ
conclude by saying
ಬೇಕಾಗ್ತದೆ
that
ಒಂದು
awareness breeds
ಐದಾರು ಇತ್ತು
safety, not fear.
ಅರುಣೇಶ್ವರ್
So
ಅವ್ರು ನನಗೆ
understanding snakes
ಕೇಳಿದ್ರು ನಿನ್ನೆ
helps us to
ಅರುಣೇಶ್
protect both
ಅವನಿಗೆ
human life as well as the wildlife, which is supposed to be
ಹೇಳಿ
the spirit
ಬಂದೆ
of
ಅವಳಿಗೆ
World Snake Day.
ಬಂದ್ಬಿಟ್ಟು
I would like to thank
ಪೋಸ್ಟರಲ್ಲಿ
organizing committee for providing me this opportunity and giving me
ಇದು
this platform to share my
ಅವಳಿಗೆ
views. Thank you.
Thank you, Dr. Jitesh.
ಅವರು ಹೇಳಿದ್ದು ವಿಶಾಲ್ ಹೇಳ್ತಿದ್ದನ್ನ ಟ್ರೈಲ್ ಸರ್ ತುಂಬಾ ಕಷ್ಟ ಸರ್ ಅವ್ರಿಗೆ ಅವಳಿಗೆ ಹೇಳಿ ಬಂದೆ ನಾನು ಪೋಸ್ಟರ್ ಅಲ್ಲಿ ಅದರಿಂದ
Now I would like to call upon the fourth presenter, that is second prize winner from PG section, Dr. Reshma.
Good evening, all. I am Dr. Reshma from MBR Ayurveda Medical College. First of all, I am thanking Team Abhijna for giving me this opportunity to present my topic here. My presentation topic was snakes in nature, which comes under the heading Importance of Snakes in Biodiversity. Specific research on snake populations found that 11 out of 17 studied population experienced declines with some dropping by as much as 90%. Main causes of snake population depletion are extreme climate weather, habitat loss, fear and misunderstanding causing unwanted killing of snakes. Ideal forest cover recommended by National Forest Policy is 33% of the total geographical area. In 2024, estimated 6.7 hectare of tropical rainforest is lost, causing loss of habitat of snakes. Sarpakav tradition in Kerala is a profound example of how spiritual and ecological values align to protect biodiversity. These are untouched microforests where the serpent deities are preserved. So why we are worshipping snakes? They are protecting us in some way.
here we confuse
When
and that
snake
ವೆಂಚರ್
flickers its fork-shaped tongue, a hiss sound, that is Chitkara, is heard. It is sensing and collecting the chemicals around us. Studies shows that snakes bioaccumulates the toxins such as heavy metals, mercury, pesticides from the environment to its body. Scientists also use snake samples, including shed skin of snakes, to monitor pollution levels, offering warning to ecosystem stress before it impacts human beings. Thus, we can conclude that through the Shitkara, snakes may absorb the Antariksha Visha or environmental toxins from the environment, thus protecting us from environmental pollutants. As the snake numbers drop, nature loses its purifier. Thank you.
Thank you, Dr. Reshma. Now I would like to call upon from UG section, fifth presenter, that is Ritika.
Good afternoon, ma'am. I am audible, ma'am.
You are audible.
Can I start?
Is the screen visible?
No, ma'am. Screen is not visible, ma'am.
ಮತ್ತೆ ಲಿಂಕ್ ಕಳಿಸೋದಾದ್ರೆ ಇರುತ್ತೆ ನಮ್ದು
Wait, we will be sharing the screen.
ರೆಕಾರ್ಡಿಂಗ್
Now you must.
ರೆಕಾರ್ಡಿಂಗ್ ಅಲ್ಲಿ ನಮಗೆ ಕಾಲೇಜ್ ಯೂಟ್ಯೂಬ್ ಉಂಟು.
Namaste everyone. Myself Ritika. I am from DGM Ayurvedic Medical College, Kadak, and the topic for my presentation is traditional method for the snakebite management, guided by Dr. T. Vidyavati ma'am, Assistant Professor, Department of Agadatantra. So I will start the presentation with the introduction that snake bites have been a significant medical concern in many parts of the world, especially in rural areas and the tropical regions. And before the rise of modern medicine, communities relied on age-old wisdom to treat snake bites. And in today's era also, in some parts of the world, like where facilities are not that much enhanced, they still using the traditional methods, which includes the use of medicinal herbs, spiritual healings, and first aid practices passed down through generations. And these methods reflect the deep connection between nature and healing in ancient systems like Ayurveda and folk medicine. Now I move to the step for the management, as it is mentioned by the Acharya Charak in the Visha Upkramas. So first step we have to do that is reassurance and the immobilization. Like we have to first reassure that the person is okay, and after that we have to calm the patient to reduce the pain, and then after we have to tie a tourniquet, that is yantra bandha, and also it is mentioned as the Arisht Bandhana by the Acharya Charaka, that the Charaka termed it as a venika, that is thread made from the hairs, and we have to tie it not too tight or too loose. We have to apply the pressure just to obstruct the venous blood flow only, not the arterial blood flow, and also it will prevent the formation of gangrene at the bite side. And after that, we have to keep the affected limb below the heart level. And the second step will be the observation and diagnosis, that we have to identify symptoms like swelling, fang marks, discoloration, vomiting, breathlessness, and etc. And after that, we have to identify the type of snake bite, like to identify the Visha Veda if possible. And the third is the mantra and the Raksha Sutra. So, recitation of anti-venom mantras for mental and energetic protection. As in an article, the author is Sunita G has mentioned in the Chaturvimshati Upkramas that mantras create a vibration around the environment, which will calm the patient, and also it will stimulate the sympathetic nervous system and strengthens our peripheral blood vessels. So, it will help in reducing the flow of the blood flow and also the spread of the poison. And after that, we have to tie the protective thread, that is Raksha Sutra, as a part of folk rituals. And after that, we have to apply the topical herbal application as a leper, that use paste made of shirisha, tulsi, nimba, haridra, punarnava, etc. And we have to apply on and around the bite area. And also after that, we can give the internal herbal remedies like administration of anti-poisonous preparations like dashang agada, shirisha churna, haridra with ghrita and madhu, and arak with the kwata. As in an article given by the NCBI, that is the National Center of Biotechnology Informations, author is the YK Gupta, has stated that the herbal drugs which are used for the snake bite have the anti-inflammatory, anti-hemorrhagic, anti-coagulant, antimicrobial, and anti-venom, and also the enzyme inhibitory activity, which will help in the management of the snake bite. And after that, we have to do the Rakta Moksha, that is the bloodletting. So we have to use the specific and selective measures to excise the bite marks, like it is called as Utkartana and Nishpidana. So mainly it is done to not spread the poison around the body, and it can be done within the 5 minutes of the bite. And it is contraindicated in the children's old age and the pregnant ladies. And also the other methods are the Chushna and the Agni Karma, as it is stated that fire can destroy anything. Then why not the poison? Like that, with these words, I can conclude my presentation that traditional method of snakebite management, rooted in Ayurveda and Agadatantra, provide the valuable insights into the use of herbal remedies, detoxification techniques, and also preventive rituals. And while these practices reflect the wisdom of ancient healing system, modern snakebite treatment with AVS, that is anti-venom serum, remains the golden standard. And also the traditional methods may serve as complementary support as a first aid in remote areas, but timely medical intervention is essential to prevent complication and save lives. And according to my views, as after the snake bite, we have to give the emergency treatment as a first aid. So traditional method can be used as a supportive practices with the other medical interventions. Thank you one and all. And I would also like to thank SGM College Udupi to give me the opportunity to present in the Abhijna 2025. Thank you one and all.
Thank you, Dr. Ritika. Now I would like to call upon Dr. Sindhu for the presentation.
ನಾವು ಬಜೆಟ್ ಕಲ್ತ್ಕೊಂಡು ಇಲ್ಲ ಮ್ಯಾಮ್ ಅಂದ್ರೆ ಎಲ್ಲ ನಾವು ಮೇಲಿನ ಕಟ್ಟಕ್ಷ ಬರ್ತದಲ್ಲ ಅವ್ರಿಗೆ ಸ್ವಲ್ಪ ಕನೆಕ್ಟ್ ಇರ್ತದೆ.
Sindhu?
Yes.
Audible? You are audible. You may present now.
So good afternoon everyone. Myself Sindhu. I'm from SGM College of Ayurveda, Udupi. So today I'm here to present you all my poster that focuses majorly on the role of traditional knowledge in snake bite management, the myths and the medicinal plants. So as you can see here, we know that snake bite has been a common medical emergency since a very long period of time, and treating death in Ayurveda is known as Vishopakrama. What happens is, when the snake is bitten at a region, the poison stays in that region for a period of 100 matra, which is approximately 2 minutes 30 seconds. And the physician, by using his yukti, should treat the patient before that 2 minutes 30 seconds in order to treat the patient effectively, or else the poison will start spreading all around the body. So basically, Vishopakrama is known as snake bite management. Vishopakrama is of two types: Samanya Chikitsa and Visha Chikitsa. By the name itself, we know Samanya Chikitsa. It is generalized treatment that can be given in terms of snake bite management. So Acharya Charaka has put forth this topic or concept called as Chaturvinshati Upakrama, wherein 24 management lines have been told with regard to snake bite management. So here in my poster, I have mentioned Arishtabandhana, Chushana, Utkartana, and Sirabhyadana. Arishtabandhana, as we all know, is tying of ligature, and it should be tied 4 angula above the bite side in order to stop the spread of the poison from the region of bite. Next is Chushana. Chushana is where the physician or the person who is treating the patient should fill his mouth with Ayurveda medicinal herbs that to protect himself from the poison, and should suck the poison out of the bite side. Next is Utkartana. Utkartana is basically incision of the bite side. What happens is the snake has bitten here, and that bite side is incised out of there. The poison will also come out of it. Next is Sirabhyadana. Sirabhyadana is basically the most effective treatment that is adopted in order to remove the poison from the person's body. What happens here is the blood which is vitiated by the poison is removed by removing the blood from that area. Next is Vishishta Chikitsa. Visha Chikitsa, as you know from the name, is specific treatment that is given. So basically, in Ayurveda, the snakes have been classified into 5 types. That is Darvikara, Mandali, Rajali, Vaikaranja, and Nirvisha. So based on the type of bite of snake, we can give the medicaments. Like for example, in Darvikara, what happens is Darvikara Sarpa bites, Vata dosha Dushti occurs, and we can give Vatahara Chikitsa and Agadapanas like Sindhuvara Vyakada and Andudikya Vyakada can be given. In case of Mandali Sarpa, Pitta dosha Dushti occurs and Pitta Visheshan occurs, and one can give Sugandhyadi Agada and Imavan Agada. And in case of Rajali Sarpa, there is Kapha Visheshan, and one can give Ushnavira Dravya and other medicaments. And we can also, when coming in perspective with Dravya Guna, we can also give Vishakta Mahakashaya that has been mentioned in Charaka. We can give Haridra, Manjishta, Shleshmataka, and Sindhuvar, and all other Vishakta Dravyas which can pacify the action of poison or venom on the body. So to conclude, we know synergy is how the environment or the earth works. So basically, by respecting the potency of the herbal medicaments and acknowledging the irreversible role of modern treatment, that is antivenom serum that has been given, that is given in present time. By working in synergy with the modern and the Ayurvedic medicament, we can treat the patient effectively, because at the end of the day, all we are trying to do is save a patient's life, right? So I conclude by saying Ayurvedic medicaments plays a major role, and along with the modern medicines. So I thank Abhijna series for giving me this opportunity to present.
Thank you, Sindhu. I would like to thank once again to all the presenters for this amazing poster presentation, and congratulations to you all. And regarding the prize, we will be intimidating soon in the WhatsApp group. Please share your.
ವೇಟ್ ಫಾರ್ ಅ ಮಿನಿಟ್ ಮ್ಯಾಮ್, ಹೇಳ್ತೀರಾ ಮ್ಯಾಮ್ ಲಾಸ್ಟಿಗೆ? ಮ್ಯಾಮ್ ನೀವು ಹೇಳಿದ್ದು ಬೆಟರ್ ಮ್ಯಾಮ್. ಹೌದು, ಅಂದರೆ ನೀವು ಹೇಳಿದ್ರೆ ಒಂದ್ಸರಿ ವೇಟ್ ಇತ್ತು. ಒಂದು ನಿಮಿಷ, ಮೇಡಮ್ ವಿಲ್ ಸ್ಪೀಕ್. ಕನ್ಕ್ಲೂಷನ್ ರಿಮಾರ್ಕ್ಸ್ ಮೇಡಮ್ ಕೊಡ್ತಾರೆ. ಮ್ಯಾಮ್ ಕನ್ಕ್ಲೂಷನ್ ರಿಮಾರ್ಕ್ಸ್ ಹೇಳ್ತಾರೆ, ಆಮೇಲೆ ಲಾಸ್ಟಿಗೆ ಹಿಯರ್ ವಿತ್ ಪ್ರಿಫೇರ್.
Namaste all, respected delegates. This is Dr. Chaitra Hebbar, HOD and Professor from Department of Agadatantra, SDM College of Udupi. So we had 2 days deliberations on a very important topic, that is snake bite diagnosis and management. So yesterday we had many delegates who presented their posters. That too, nationwide delegates came over in the webinar, and they have presented their insights about the important topic, and maybe this will give rise to more further researches in these regards. And today's deliberations, that was initially we had the inaugural session. Later, Dr. Satish Rao from our own educational platform, that is AFI, Ayush Federation of India, Udupi, he presented. He is a secretary of this platform. He has presented overall considerations about the snakes, their identification, management, classical understanding, etc. And later, our own Dr. Muralidharan sir, principal of MBR Ayurveda College, a very supportive personality, that too, who has a very important understanding of this particular topic, presented on the snake bite diagnosis and management. His inputs were also considered by the delegates, and many questions also arose, and sir has patiently answered. And later we had Dr. Srinidhi R, who presented on the community preparedness about this particular topic. And his presentation also highlighted many things which is
very much in concern with the public, where the public has to prepare themselves and how the doctor can prepare themselves to understand this particular topic. And also, it was followed by Dr. Anjana's talk, that is about the important 24 upakramas, and total classical orientation was given by the speaker. So 2 deliberations from our own department also has helped the delegates. So overall, the day today, the CME day, was very much appreciated by many of the delegates. Soon we will be sharing the feedback form also to you, which you have to fill, and later the certificates will be provided. And as you have already witnessed, the 6 presentations, 2 from the faculty, 2 from the PG scholars, and 2 from the UG scholars were given the opportunity, the one who bagged the winning prize. And I'm very happy that their efforts in understanding the subject, in designing the posters, has given rise to the appreciation by the judges. And judges were Dr. Srijit, he is the associate professor in Nutan Ayurveda College, Gujarat, and Dr. Shubha PU from our own department. She's from SDM Ayurveda Ayurveda College, Udupi. And we also could tell or announce the best reel making prizes of our own podium, that is second BMS juniors and senior batches, and it was judged by Shidin sir, Dr. Shidin. He is associate professor in MVR Ayurveda College. So overall, many hands helped us, starting from our principal and our management and our office bearers and all you precious delegates. So the day has come to an end, and thanks a lot for being with us. And we would like to organize such a seminar, such platform, educational platform, even in the future. And we would like to see that you all come along with us physically and also virtually. Thanks a lot.
Thank you, Dr. Chaitrama. Thank you all for your active participation. We hereby conclude Abhijna National Level Online CME Series Volume 2 2025, and all delegates kindly fill the feedback forms which will be put in the respective WhatsApp groups, after which you will be receiving e-certificates. You will receive e-certificates only after filling the feedback form. Thank you, one and all.